recording in progress.
We have a lady on the county road up here picking up rocks. They visited with her this morning.
Like,
If you find a part to my road grader, put it where I'll see it.
By the way, should I report to the sheriff's office that there's a semi, looks like a NAFTA driver that broke down out on Secretary.
If you would like.
They're downstairs, but all of them.
Well, I mean, I don't do it now. Don't do it now. They're in their MDT meeting. They're discussing stuff that's confidential in there. So, but I mean, you want to call dispatch and let them know or contact them later on, whatever that would be. Good morning, everybody. It is Wednesday, April 29th, April 30th, 2025 at 9:06 a.m. And the Harney County Budget Committee shall reconvene from our session yesterday. We left off the next budget, or the next fund will be Fund 223, 911 emergency. Any comments or anything before we get going?
Yeah, just an overall comment. I mean, it's an important service. And, you know, when the new allocations from the state, the increased allocations happened a couple of years ago, whenever it happened. I would just really like to see them try to live within their means as best they can. Is there a couple 100,000, almost 200,000, you know, no. You know, so I don't, again, I think I've never heard they're not doing a great job and all that, but that was just my thing. They're still getting a transfer from the sheriff of $25,000. I'd like to see that stop in the future, and from the general fund.
So the transfer from the sheriff at 25,000 are user fees for all the different user groups. The sheriff's office, Burns PD.
Oh, I see.
Hines PD.
So that's equal to those.
Yeah.
Put it up here, but it's down there as a transfer.
Actually, the sheriff's office is less than Burns and Hines because we manage it, we house it. So we're already got in-kind
right
money
and when
into
the BLM quit paying, I mean, years ago they paid, and I would think they still should.
They still do, but it's yeah.
Oh, okay. Thank you. I would send that to you. All right, let me get oriented.
Wasn't there talk about charging more from the cities and such? Is that still going to?
The cities have raised, they're being raised from 25 to 30.
Okay.
In
There's a seat up here for you.
Unfortunately,
And
for
there's like
who knows what reason, because none of us were on the
the.
board then. Years ago, there was a period of time when it was in good shape financially, and they just waived the user fees for everybody for like 5 years or something.
Geez.
Yeah. I mean, you can go, why would you do that? Why would you? Well, they help each other out. It's our tendency not to charge fees. Okay, that was my only general comment. Was they're a good outfit. They get some good revenue. Wish they could.
So they're
Economically, if they can.
they don't as well, it's consistent from last year, but you can see that the cities their user group fee is $5,000 more than the sheriff's office, and the county's is. And beyond that is, you know, expenses, no new positions, no new materials and supplies. I mean, it's all pretty consistent there.
And the CAD grant got fully expended and everything's been delivered and working.
I think they're still working on transferring of data and whatnot. They did end up with a hiccup on that where the previous vendor for the previous CAD system was going to let them have the data. They weren't going to, weren't calling it proprietary or whatever. And we're gonna let them have the data at no expense, and then later on, they changed their mind or somebody spoke out of turn and said, no, we're gonna have to charge for the data. So there was some extra expense there, but I haven't heard any. They must have been able to handle it within their budget because I haven't heard of any other requests beyond to
Okay.
for that.
And yeah, no, I think that was one of the fun.
But you haven't charged the tribe more.
That contract is up, I believe, for renewal as well. And I think they are working with BIA on that. Because those funds come from BIA.
Mhm. Well, and now they don't even have their own police force, so.
They just have BIA law enforcement presence once in a while, or?
Well, last I knew, the city of Burns was talking about taking that over. And Jake was at the city of Burns. And
Was that a while ago?
no, that's been talk. He hasn't been a cop that long, so that's been the past year. So, they were gonna do it, and he even went through the training, you know, because there's federal BIA type training they were gonna take it over under a contract, but it wasn't coming to fruition.
They're working on it.
Yeah.
There is some hurdles there because while the tribe is sovereign nation and cases that they deal with there will have to be dealt with unless they come up with some other agreement for those cases to be heard by justice court or whatever, but I doubt that will happen. They have their own
Tribal
court.
court, yeah.
So those officers, when they're working any cases out there, would have to run all those cases through tribal court. So last I heard, they were still talking about it.
Yeah.
That's all I know. But there are obviously some hurdles that they have to jump over to get to that. But so as far as this budget goes, I think they are in conversations with BIA and there might be some additional revenue there. Again, if it's not budgeted for, if it's less than 10% or more than 10%, it's just going to roll over in the beginning fund balance if they get more there.
So, and they have a full staff, dispatchers now.
Yeah, I believe so. Yeah.
Okay, and they were talking about maybe changing what their work schedule was. Did they change that at all?
I don't think they have yet, have
Not that
they?
I'm aware of.
And when we go to material and supplies, I'm comparing the 23-24 actuals with our proposed budget figures. And you can see that there's increased our material and supplies expenditures quite a bit. I was just wondering, any comments?
Ooh. You mean the grand total?
The total materials and supplies.
Yeah,
yes. It's
109,000
really-
versus 60,
That
yeah.
just keeps going up. I thought mainly it was gonna be that the personnel
Well, there's that
positions keep going up, but it's
36,000 in there for that. Common equipment?
yeah,
Maintenance
comm
install?
installation. I mean, how many years is that an annual expenditure now?
I don't know.
Also,
I wonder if-
remember that the administrative cost and HR admin got moved.
Yeah.
Uh,
Yeah, so that would account for 11,000.
Yeah, just wondered.
I think
when
it's
and when
those two
such
things,
gets back into-
basically. That 11,000 plus that 36, which is zero in 23-24.
So, Bill, the Palmolive maintenance installation line, has a $36,000, the current budget year, and in the proposed, is this gonna be an annual charge or fee?
Is that for the new Motorola thing? So the budget was 36 this year. We spent 27.
What is it for?
Would it be part of the Motorola?
There's all kinds of things.
Was it, would you guys know if it's an annual
All
thing?
those things that us. Construction.
Their submittal doesn't have any notes on it for
Yeah, is that gonna be a recurring annual?
It's,
See,
I
and
mean,
what's it
it's
for?
multiple things that,
Yeah,
that total that expense of 27,000, that would be a good question for.
yeah, cause, 3 years ago, we had 0, then we had 21, well, then we had 21,000, now it's up to 36 and.
So
Well, again, I'm
What
gonna
is it?
remind the committee that um it's been 3 weeks since our last budget hearing and our budget committee meeting. And I'd asked that if anybody had questions that needed to be answered by these departments to have those in or
I do
to,
understand.
and if we're gonna do this in the future, this is the way it's gotta work or else I gotta start parading everybody through here again.
Well, can you make a call and just ask either the emergency manager or the 911 supervisor if they can tell you if that's a recurring for the next few years? We don't need a presentation.
was the
No,
six
but it'd be
hundred,
nice to be prepared for it.
was the $655,000 budgeted last year? Did that capital outlay happen with new equipment?
So what happened is it got budgeted twice. I think by accident, because the CAD grant. We had budgeted at 500,000, it came in at 563. And we had it budgeted. As a material and supply, and it also got budgeted. And it's a capital outlay by
I
accident,
see that.
so. That's a one-time shot, we use, and then the 655 is,
But it got budgeted and then it never came to fruition. It doesn't look
Look
like,
at
because there's
something that
nothing in the
probably
action.
it's gonna be-
so the.
Yeah.
They had put that money and the county,
They'll know.
they
This
allocated
is
that money in
just
case the
for-
grant didn't come
or
through.
this
And then the
is-
grant did come through, so they didn't need that
But see,
allocation.
there's some,
That was the agreement. You can look.
there's
county
weird,
minutes.
there's weird things in there. So, which,
Well, anyway.
I don't know what these guys
the-
stop.
Oh, I see.
Hello, Dawn. This is Bill. How are you this morning? Good. We're in budget committee and are you
So this
looking at
is,
the
Did I say
just a second, Dawn, I'm sorry. Is the communication equipment maintenance installation line, is that the one you're referring to?
Yes.
So the line 3710 actuals for this year is 21,000. In the past couple of years, they were 0. Is that a new line that was in there for the upgrade, or is that gonna be a new reoccurring cost? Okay. So this year's budgeted amount of 36,000, that's still pertaining to the upgrade, and then next year, or well, subsequent years, that should drop off. Okay. All right. Any other questions while I have her on the line?
Anybody else? Thank you.
Rob, it seems like payroll has gone up more than 3% approximately. Curious if that's because there was change in the personnel.
When they went up 4%, I had to repay them for 4% and go back and retro from July.
Yep.
Because that was part of the new
So-
contract for 24.
All right, I think that's it, Dawn. Thank you very much.
It's 3%,
Bye.
25, 26. So,
So about 7% is what they went up, which is what I figured.
Yeah.
But their PERS went up 30%. That's. Their payroll went up around 7%, but the PERS went up 30% from the budgeted amount last year. Which seems high.
and I know just one of them in there is a tier 1. The rest are officer at the lower rate.
$7,557.59 times 24.44, or what was theirs? There's 28, something, right? 28 point,
Well, they're not.
they're not police and fire.
It's 24.44 except for one of them. It's a tier 1 rate, so.
Their revenue doesn't even cover the personnel services.
Based on what you were showing me, and that had a bunch of things. And then based on what the answer that Judge Hart just got about, it won't be a recurring thing. It'll get budgeted this year and should be done. Still makes sense with what you were seeing on your screen.
The only thing that didn't make sense was there was some Ed Stop stuff in there that doesn't make sense. That we'll have to look up.
Okay. I'll just print it off the email.
Appreciate,
So I didn't hear what the answer was. Is it recurring?
no,
No,
No, it's part of the upgrade.
okay.
It's part of the Motorola CAD, computer aided dispatch
Okay.
upgrade.
sometimes contracts, have every so often updates and things that they get charged for.
Which they will. It does have, I think, in the second year or third year, it has some fees associated with it.
Personnel, are you investigating something for training the
I'm
dispatch?
looking at the PERS.
Okay.
So roughly, the overtime. Rounding roughly, I mean, I didn't to the dollar, but our PERS calculation by Tyler comes out to 119 as listed. And my rough calculation is 109,000. That doesn't include the 4,800 or 48,000 for overtime. I didn't add that in. I was just adding salaries. So that's probably pretty close for PERS at 24.44%, plus one of them is a tier one.
So they do have two more people, two more FTEs than they had a couple of years ago.
Yes, they put on a new one last year.
Yeah,
Yeah.
Has the turnover slowed down over
I
there?
think so. Yeah.
Um, you have more questions?
I tentatively move to approve 911 emergencies presented.
tentatively move.
Yes,
I move to tentative.
approve.
You get the point.
I'll second.
Motion's been made and seconded to tentatively approve Fund 223 911 emergency. Any further discussion? All in favor signify by saying aye. Aye. Opposed? And hearing none, motion carries. Next one will be Public Health Fund 245.
Just curious, did we already do the first meeting, the Clear Event Center project? 224?
I believe we did.
Okay. Just couldn't remember. Didn't have it was written all over that one.
Was it 252?
Yes, 224.
I gotta get there. What fund is it? 2, 4.
And then
You have to
224.
take bigger jumps.
We did that already, so.
Yes, that was the Fair Event Center.
Thank you.
So nothing out of the norm here, just a 3% COLA. The
Wait,
TPEP position,
excuse me 1 minute. On the agenda. Let's see if that's correct. Are we on 226?
we're on 245.
226 and VOCA we did yesterday.
Oh, okay.
Fund 245, Public Health, RHC.
We want to do those separate as public health. and-
Yeah, different departments like we've done the other funds. So the first one being Public Health. No increases as far as FTE. You will notice a decrease actually in FTE from the TPEP coordinator. They could never fill that position. Anybody interested in doing it? So they just zeroed it out.
What was it?
Tobacco prevention, and smoking cessation program.
So the RN at one FTE at $143,000. That seems a high for one nurse. And the same way with the director. Well, that's probably right because 23-24 was 90,000, so that's probably.
So I have, over the last 2 years, it's vacant right now. We have it bulletin. And I have it budgeted at high, just so if we get somebody that we have to start higher off, with experience. It may not come in at that one. We get it filled. It might come in at 85,000.
So you're gonna have two or you're replacing the one?
We don't have one right now. We don't have a director right now. The
Oh,
position's vacant.
So the
But we have
actuals
two
reflect
people.
what?
We have two people doing it. and
I
so we're-
see.
Interim,
okay,
acting, whatever.
okay.
And so those two people, does that come out of the,
Comes out of the director's line.
just the director's line?
Well, their normal salary comes out of their line, and then the additional that's paid to them for their acting role as the interim public health director is taken out of the director line.
So the. Okay, that's. Question?
So what was the answer on the RN?
I don't see anything weird with her.
So is that an error? 143,000?
That's the.
So was this plus this COLA.
What's the?
Yeah, the last 2
benefits and
years
everything?
it was budgeted
So
at
one
that.
seven-
175.
175.
That's
Is that partially funded out of RHC too?
not specifically.
How far are we into this per year roughly? Like around 75%? As of April 2nd, when this was printed off, I guess.
2 months left. So it'd be probably more than that.
Yeah, April, May, we'd be at 75% as of when this was printed.
So the increase in the RN one FTE position from 23-24 budgeted to propose now, that increased by that amount, why?
From the
92 to.
143?
Yeah. Increase.
That's my question.
Because if we're at 80%, the actuals be 114, just significantly more than.
Now I have a note on last year's that you were gonna get a new
Yay.
nurse practitioner to replace the RN.
No,
Is that,
no,
oh, no.
we're gonna
Okay.
get another nurse practitioner. But that's
Okay.
not, this is public health. Nurse practitioners work in RHC.
Okay, well, I don't know why I have that note on there from last year. One question I asked.
Maybe three.
There's,
I got confused last year. Yes.
and they just asked me to post the PA position again, so.
Yeah, it sure seems like that RN budget would be a little lower.
It seems like the
Have an RN.
pay
I
rate
think
is
we're
very
gonna have to go forward.
Yeah,
in this department.
And yeah,
from
they have
at least $20,000 off of it. It really sticks out.
Yes, good morning. This is Judge Hart over at the courthouse. Is Kelly available? Okay, thank you. Good morning, Kelly. This is Bill. Hey, we're in budget committee and we're looking at the public health RHC budget. And under public health for the RN line. Last year it was, or 23-24, it was 92,000. And then 24-25, it went up to 143,000. And then budgeted that same amount again this year. Okay. Okay, thank you.
And then the disease specialist is one full FTE for 27,000.
Actually, she's not. She's half-time now.
Okay,
So that
so
would have
that
to be
is a
changed.
0.5 FTE.
Yeah.
Okay. I had a question about that. I have written down 0.5 FTE question mark.
Point
Mhm. So, there is another. One of the nurse practitioners does work out of that line on an occasion.
Okay,
So that's why.
So she does put in some time at public health.
Versus, yes, she does, RHC and public health, so,
Okay, so the
That would-
new NP is correct from last year.
yes,
Okay,
so. Estimating
so that's one RN plus
plus,
some FT. So this FTE should be.
Sorry, are you talking to me, Kelly? I could barely hear you. I didn't know if you guys were talking to each other or what.
I'm not sure how to calculate that, cause I think when they go to the tribe, then that's a public health thing, I think. And she's got some programs. that
Okay, so
she does.
from 23-24, it went up $41,000 or $51,000. And that was because of what now?
She does some reproductive health. The EO1, which state support, something other, some other
Okay.
project things she's got
And
going.
who was that? Or who is that? Okay. All right. And how long has she been on? Couple years? Okay. All right. That's what I needed. Thank you. So
Another individual working out of that line as well.
no, they said that it's the existing nurse.
Yeah.
And when that person was hired at a higher rate than the previous position. But that doesn't, because she said,
Well-
it's,
I know.
and that was hired by Alex and, well,
Yes.
the previous public health director and,
Yes,
and,
but there's also some of that line is from here. Working out of that line. When they do, I believe, when she goes to the tribe. she works.
She's
up a
billing
lot
out of that line.
because that's a public health thing.
Okay.
Is that reflected in the revenues? The payments from
The tribe,
the tribe?
yeah, we ought to be,
Public related, it's probably because payments from all the family. I mean, we don't receive payments from the tribe.
well, when Melanie worked out there at the tribe as a nurse practitioner, she billed them. I mean, she didn't work for free, so I don't know why they wouldn't pay you guys.
If it's that would be a good question.
If the tribe is partnered with the state of Oregon for public health services, then that would be part of the OHA Community Partner Program, probably funds that we get from the state. But
It looks like we're budgeting this year for $150,000 that we did not budget for last year or the current year. And so I don't know if that does include any possible tribal work or not.
Well, I know Twyla went through some health stuff, so I don't know.
well, as I mentioned,
So,
this is the complexity of this fund.
yeah,
If this is one that you'd like to have them come in next year,
well, I guess,
Yeah, next year, let's road. Maybe. Just in case.
So you know how you had that first meeting, the governing body, you went through that. That's where I think that should be personally, those, you had that meeting and we were.
and we
here,
could
but-
expand that meeting for that kind of stuff
Yeah.
as kind of the pre-negotiation, whatever, like I do with the departments myself. This year I only did that where there was asks, where there were specific asks for either personnel or materials and supplies, but it could be expanded definitely into those more complex departments where
That's where I think that, should lie with the governing body.
Will the pay scale study include these jobs as well?
yes.
so Bobby Joe, this MAC match in this one item and materials and supplies, is that a match for a grant?
Medicaid. Isn't it?
Medicaid? Yeah, like a match.
I think it relates to Medicaid.
Because I didn't see MAC per se in the list of grants, so I was just.
The quarters listed, but it comes. I'd have to go look to see. They send in a payment and then in return get, so we every quarter. So I like to.
So under revenues, fees and fines, there's a line for MAC match.
Oh, I see it up there. Okay. And you think that's Medicare, huh?
It's not,
Medicaid.
Medicaid.
That's my recollection from years ago when I had a different
Huh.
job. Maybe that's not.
I'll double check with.
It seems odd to me, but it is the federal government.
Well, if it's a federal source, we'll probably need to look at moving it underneath the other.
I'm gonna go look right now. I don't think it is.
Contract services, is that for, what is that for?
Is that for the medical doctor?
Oh. Yeah, nurse practitioners do have. to
Or
have something like that.
Could be anything.
That's what I asked. Well, there's also professional services line. So.
Let me look at one, let me deal with one first.
Yeah,
I need to verify it with you because when the invoice comes through, I don't think it's enough, but I'll reach out to them.
Do you know who that is?
Thank you.
Lindsay.
Yes, she does. I think it's, dietary. She does something. She's a dietitian, I believe.
oh,
Okay, so that would be there are several different things that are billed to that contract services
okay.
line. And then
I didn't ask any
She's been-
questions. in
they've
this
seen her
last
for
year.
years.
I never got a chance to read it before.
and then the other one was the professional services. Is that-
Yeah.
There it is. That one is, I believe, the doctor.
Yeah,
I don't know that, again, this might be something, if we had them here and if we weren't doing it this way. On revenues, under state sources, we used to get money for disease specialist revenue, but this year we're getting zero.
So
Is that?
what happens is OHA plays a bunch of money up front, and then they have to report on programs.
Oh, that's one of those.
So that's
Because
why
it
you
was
see
in
some
the
negatives in here.
45, 34, 31.
And if we have zero exposure,
Services?
we still have funds in our pocket if we need them, or?
So they pay it up, and then if you don't use as much in a certain program, then they take away the next one. In the end.
Billing to all
biennium,
over.
it shall
all over the place lines.
If you say so.
Somebody over there.
The real world, the cost increases, if you look at the vaccine. What were 40,000, 57,000, now we're 775. Thank you, pharmaceutical companies. That's the real world.
so repairs and maintenance there's been some fairly significant numbers in there. Now it's just 2,000.
They didn't have any projects this year. Like last
Okay,
year, they
they got
did
it all
floors, they
fixed.
redid some floors, they redid some cabinetry work last year.
That's what I think.
The year before, I think it was parking lot. They had some parking lot work done the year before. So they didn't have anything this
I
year.
think that's what it is. Cause it's a common term I remember from other jobs I've had for years, I mean, before. Maybe I'm wrong in
No,
this
that
case,
always
but
sounds
I do
right.
think it is a Medicaid match.
Which I guess could be, right?
It's
So,
BS. It still exists.
I'm confused. Are you moving? Are these supposed to be moved? Oh, they did get moved. Yeah, they're zero. Okay, never mind.
For
They
the
got moved.
administration
Yeah, they
category.
got moved.
Going through, after it. To the administrative cost and HR admin line so that they'll stand out a little easier next time. Reports.
Did you make a note on that TPEP one to be zero?
Yeah, it
FTE?
is zero. actually.
Okay.
Cause Judge Hart had asked me to adjust some of the FTE, but I don't think they printed any pages for them.
That was after I printed these. So the TPEP should be zero, and I didn't know about the disease specialist going down to half FTE. I think all the other FTE should be correct.
Oh, yeah, I got moved. So no.
Well, the good news is they're in the black. Okay, there, I want to always praise that.
Sorry to get so hung up on PERS. How does that work again? How many FTE for them to be in PERS?
It's not an FTE, it's they have to work 600 hours a year to
Qualify.
qualify for PERS.
Which is
Not very much.
one third FTE,
Everybody,
because you figure 2,080 hours a year.
Because it seems like they went down almost like $70,000 or $80,000 in payroll, but their PERS went up
well, remember, we had an increase in PERS.
12%. And you said it was like a 9 or 10% increase. And it seems like if PERS is roughly 24% of the payroll, then 95,000 it's significantly low, which is why I bring this one up, because I just don't understand. If total payroll's around $555,000. PERS just seems really low.
There's one, well, I have a note that I need to look at all of the PERS. But, there is one in there that is a tier 1, so
And theirs is 28 point something, isn't it?
something like that.
28.71.
So is there one of those positions that doesn't have PERS or is throwing a kink in it to make it be 95,000 instead of like 133,000?
Everybody is PERS, and they share, just because like the RN nurse practitioner says 0.30 FTE in public health, they're making up the rest of it in RHC, so they're a full-time employee. But all of those are,
So there is a
PERS.
full-time clerical just for public health?
I think she's paid out of public health, yes.
And then there's a front office person, full-time for public health.
I think so,
Supposedly.
as far as I know. But they so intermingle over there, it's very, very, very hard to track.
So.
Want to see what it is?
I wanted to know what the revenue under other grants and gifts called grant revenue is, because that one has been a good one this year, but we're only proposing 50,000 for the proposed budget. I just wondered.
Bobby can answer, because it just says deposits. Something in March.
Just wondered what that was, because it's,
Which line is that?
it would be 3,500
They've got a big
grant revenue under other grants and gifts.
No, yeah.
That one's had a nice peak right now. Is that for less next year?
calculation, in these
Mhm.
salaries. I'm coming up with $135,000.
Well, like I said, I'm gonna look at all of hers, I
Yeah.
think, before we get done
I
with it.
think that's what.
I can't
That's
imagine
gonna-
the same. 181.
We need to look at it all.
I'm sorry, unit.
Can you resend me the
We
language?
get various payments from, and it just says,
Yeah.
June 24th and
Probably have
25,
that, just not see
one
it.
times pay. And then March 24th, 25, one times pay. For a total of 181.5, so we'll have to ask.
That was a bone ass.
So you think the PERS is way understated on this, huh?
Something is not right with it.
Oh, that throws their budget even more off. So,
Did you bring all those treats? Right?
pretty much does the RNC make up fund balance issues?
For public health. You know,
Does it what?
Does the
RHC?
RHC pretty much make up fund balance issues with for public health?
Yeah. Public health has been pretty solvent the last few years because there's been a lot of public health money from the federal government.
Yeah,
Modernization and Healthcare Act. So they've been pretty solvent themselves for the last couple of years, but that was the whole reason why the whole purpose of creating the RHC was to cover that any negatives in public health so that there wasn't general fund didn't have to.
and I see they're also sending money to some health and hospice too.
So in years past, home health and hospice has received a transfer from the general fund. And if the RHC dollars, those dollars are pure profit from
Yeah.
RHC. We could do whatever we wanted to with them.
Yeah.
But I don't want to spend them on that they were created or generated in healthcare. I'd rather spend them in healthcare. So instead of having the general fund carry that burden for home health and hospice, I'm having the RHC profits keep home health and hospice propped up.
Yeah. Makes sense.
so you think it's not calculated?
I don't think it's calculating first, right?
At any rate, if the salaries or the pays, compensation, Deanna, for this department, even if some of them look like a big jump to me, if they are appropriate, if they are not a mistake. Just want, I mean, that's all I want to know. I mean, to me, some of them just look at, how can it go up $50,000 in 1 year, right?
Well,
I mean, I don't understand, but. You know, as just all of us being stewards of the taxpayer money and or catching things,
Sure.
catching mistakes, you know, that's what we're doing at.
it's, again, it is so hard to tell with these guys because they are intermingling. When they enter their time, they enter a project code and a GL line. So people in public health work in the RHC and people in RHC work in public health. So unless I literally sat down and did an analysis for the whole entire year, and the next year could be different.
But I
I
mean, they've got, as an employee,
Mhm.
they have a salary, right?
Right.
And whether this fund, that fund, and that fund are all part of things they do, okay, but. I mean,
They're hourly employees, so they jump back and forth. I don't know how to answer the question.
So
okay, well, that's a
what's the-
bigger question, but
What's the question though?
like when I just asked Deanna if, like, you know, when we look at it, we don't look at this all during the year until this time of year. When we see that a certain position has increased in its salary by $50,000, and we just ask a question, why was that? How can that be? And then I just asked Deanna, if as you look at these employees in this fund, I mean, is that
Are you
your
talking-
understanding that their pay is appropriate, even if it looks like a huge raise happened last year from one year to the next to us?
But I don't think it was a raise. I think like this thing looks at it and says that we do a spreadsheet and part of like on that RN line, part of those wages, it's not just one person. And, it could have been, it could be,
Oh,
I know that it's at least two people
all right.
in that line.
TE,
Exactly,
there's multiple people
Correct.
billing to the same client.
exactly.
And they probably bumped it up to assure that there's enough in there to pay for their hours if needed.
Okay.
That would be.
Yeah. I mean, I just found the second person that works in that line in April alone. So,
That's dangerous.
So I think one of the things too is what Rob just said, that the public health and then the rural.
the RHC.
Yeah, like see, that one is over. On the purse, so I think maybe that's that.
That's what I was wondering. I was gonna go look at that
Because I think
because
maybe
if
that's
they are
the
crossing
difference.
over,
Yeah, I think that's what's happened on that line too, this one.
it may
You said that,
be
and I looked at
confusing
it.
Tyler. 'Cause
It
he's
may
not
be.
a very smart guy.
It may be confusing time.
So that's what I would agree with you. So, that's, looks like that.
One thing on the RHC budget. That top line of 249,099,999. That's take that out. Because that's that when we were gonna lump all the salaries together.
Oh.
And it didn't get,
That line,
29,000.
the 1,000 line should be zero.
yeah. Cause that was when we were gonna lump all the FTEs together.
Well, that's why it says 0.5 plus.
Oh, that's 240.
Yeah.
RHC.
240, I lined it out, I could, that was at 0 or
The
9.
billing line right now.
Well, actually, they do have a salary line that they've been using for quite a
Yeah,
while.
they have.
Since,
So that's not one of those
that's
ones that
not
we
one of
created.
those. No,
Okay, well,
no, because there's several people that are,
7.
Yeah.
It says 7. 7.
And so
Seven.
what does that line depict? 7 employees
billed to that salary line.
and that is in addition to what we see for the salaries per position?
Yeah.
So then the 240 needs to stay.
yes, it does, my error.
I was. First one from, see, I was just. More,
Oh,
so it's not,
so it's not.
which means. there's-
So
There's
you're
7
talking about
employees-
this
there's
line right
7
here.
employees that don't have their own GL line. That are,
They part-time? What are they? Why don't they have?
Pete changed that, way back when and put the salary, do you remember that?
Yes,
we do.
Yeah.
Absolutely we do.
Should we ask for next year to change back to? I mean, what's the benefit of tracking something that way? Can't track it.
I don't know. So what about this billing that doesn't have
An
a,
administrator,
under the personnel
We need an
services
administrator
under public
overall.
health, that has a half F
that's
plus
what I was pushing for.
0.5
Not just
plus.
public health director, but an administrator.
Well, I proposed last year, would still like to have one, but a public health
Oh, it's a
administrator,
billing
a
person.
health services administrator that would be over all healthcare services.
Gotcha.
Would be the overarching management position for RHC, health department, home health hospice. But we have an announcement out right now for the public health director position. Which I don't know if we've had any applications.
Nope, not even an inquiry.
Well, now is not the time to go into that field.
So back
Become that
in
person.
the beginning, when the RHC was created, it was, two. One would, it provides another option for healthcare in the community, and number two, it was, it would be profitable enough to help offset the cost of public health. Because public health was a big expense that was getting bigger and bigger and bigger as it has become more bureaucratic over the years here in Oregon. And, so just as I look today, just to, so if you combine the bottom line of the public health budget with the bottom line of the rural health clinic, combine them together, because one, public health is in positive by 43,000, rural health clinic is in the negative 62,000. So that means it's costing us 20,000, 19,000 something. Overall, if you want to.
The
look at it
total
that way.
revenues for both departments is 3.3 million. And total expenditures for both departments are 2.4 million.
I was just adding up the revenues over expenditures from both of those, and it's a difference of 19,000 something. Unless I'm doing it wrong.
Well, that's total resources. Total revenues are 2.487. Total expenditures are 2.466. And then you add the beginning fund balance into that for total resources of 3.3. So total revenues are 2.48 and total expenditures are 2.466. So they're in the black. As a fund as a whole, they're in the black.
And one of our flushes, the cash balance.
And do you have to spend much time on admin or not for that entity?
Actually, I feel like Deanna does more with the sergeant one piece of it.
Yeah, they're moving stuff around and a lot.
They're a large part of the audit with the CBS and all the different little bits of money that come that all has to be reported. And the ones which is a real pain.
And the state is always moving funds around. I think we're on like amendment 14 or something like that right now to that contract.
And
And all their reporting and the whole idea behind the project codes is so that they don't have to keep track of it manually. And so everything they do, it may be 15 minutes, they bill it to this project code and this GL line. This 15 minutes, maybe this project code and this different GL line. So it's every single one of them, because every single entry in payroll has to have a project code attached to it. So
every piece of their accounts.
active.
Like a law firm.
And a lot of that goes towards that modernization and healthcare act and having to track the hours and expenditures under each category of that grant.
Of all the stuff they have going,
Yeah.
because. And then the reports get run at the end of the quarters or the end of the month, depending on when they're reporting. And then they're going off those reports to spend the money, and they're, Vicky's watching it very closely, sorry about that. Watching it very closely to, make sure she's not going over or under.
She's actually at best.
Yeah.
She's.
Who's this? With all the questions and comments raised, is there any reason we should move to approve? Or is there more discussion or?
I don't have any issues with their budget. There's some ups and downs in some of those lines. Would
As it
definitely
should
need
be.
to investigate the PERS side of it and make sure that we're not underfunding there. But
And that goes with all of them.
yeah. But they're more than solvent with the beginning fund balance.
Then I would move to tentatively approve Fund 245, Public Health. Did you want to do RHC at the same time?
We haven't looked at it
Okay.
yet.
Let's do the public health one first.
All right, tentatively approve 245 Public Health.
I'll second.
A motion has been made and seconded to tentatively approve Fund 245, Department 045, Public Health. Any further discussion? All in favor signify by saying aye. Aye. And opposed? Hearing none, motion carries. Page 5 of Fund 245 for Rural Health Clinic, Department 050.
I would ask that on that personnel services, the top line salaries FTE 7.05, that I would just like to ask, is that a good functioning thing to have anymore? What does it mean? Why is this the only fund that does this?
I think that Judge Reynolds was, like Judge Hart tried to do this year, was planning to move everybody so that everybody's, all salary lines in all funds and departments move to one line. And this was where he started with.
Okay, so do you know, Judge Hart or anybody, if we'll find that in a few other funds that was tried, or was this the only one?
It's the only one I'm aware of.
Yeah.
I would suggest if we're not going to go there, that we take that out. I mean,
It's kind of like the next line down, nurses, 2 FTE. There's which if there's 2 nurses being billed out of that, $100,000 is not going to cover it. But then their FTE is not aligning correctly with their total staff
right.
numbers.
it'd be nice to get the FTE just more accurate.
Yeah,
Accurate. And then again, so are you saying that salaries FTE 7.05 line needs to stay?
Yes.
And
so you have a whole bunch of people coding their time to that on their timesheet?
they coded that, but then they also code to other things.
That's confusing.
How many hours are there in a day, for people to do all this work?
But nothing's gonna change. I mean, it's this geo line or just geo line, because they're constantly,
So
they could use 27 different
If you
geo
took
lines.
that line out, and you still have nurse practitioner, 2 FTE, physician assistant, RHC clinic manager, etc. What is captured in that top line that is not being captured in those subsequent staff lines in this fund?
There could be billing and,
I mean, is that kind of like a cushion?
no, it's
No, it's just that
people.
there's so many different people that are billing out of that, so rather than break them down into different lines.
There would
they're-
be 7 more
they're-
geo lines.
Yeah, they're all billing out of that one salary. Cause they're doing so many different areas.
So there's $240,000 we're budgeting for all
For
that
7
that they're gonna
people.
bill, plus a nurse practitioner, the next line, there's 100,000 for that, I mean,
I think the salaries line too, it's like the support staff,
Yes,
right? Like the clerical and the front office
billing and, yeah,
and all those things. I personally like the one line, an ease of payroll, less mistakes to happen so that the wrong lines are not getting billed.
I think there's just a complex thing because of all the different areas that they have.
It's
they have to
working
bill
And we're
for.
using project codes to build their specific grants.
So we tried the first of this year
And
or
it's
this,
been working. When we
Yeah.
started it.
yeah, long time ago.
We built this line in 21, 22.
does having that line mislead when we look at the total for professional services is
Why would it mislead? I mean, I don't understand where you're coming from, because it's a personal services line with a total of 7.05 FTE, and that's the total of all their salaries.
and those people's salaries have nothing to do with,
No,
With
no, they're
No,
different people.
they're separate, they're support
So-
staff.
so how many total FTE are there over there right now?
Tell me.
Thank you.
Maybe that was mine. I forgot, maybe they. a lot less than-
How many FTE is this community health worker? Cause it's not on there. And it's only 20,000. Or is that some kind of a contract thing?
No, it's not a contract thing.
So I have 14.5 FTE and public health RHC.
No, I don't think that's high enough.
I have 7 well, I'm sorry. I have 7 employees in public health, 9 employees in RHC, but that's
Oh,
not.
these might not all.
Yeah,
be full-time
1455.
people.
Yeah.
Because they're in both areas. That's why it's so complex.
That's why it's just a
Yeah.
little bit with that part. and it makes it
Yeah.
one-
55.
143 is-
Well, now I understand. I thought.
Two.
Sorry. Just thought something was getting
I'm telling
messed
you.
up.
If one of these other support, or one of these other people here need to bill under that salary, they're gonna bill under that salary as well. But that's not the normal,
Right.
but everybody could bill into that depending upon what they have going and what
Program they're working.
program they're working on. I mean, the big thing for them is the project codes. And
I think there's.
I mean,
so much.
this is so
complex beyond our
confusing.
level. Yes.
it honestly would
She
be
does a good
easier.
job of breaking it out.
It honestly would be easier for public health and RHC to be one line, public health be one salary line. RHC be one salary line, because what it's important to them is the project code so that they can bill to each one
Right,
of
to get
those.
reimbursed.
Yes.
Well, I like seeing though the different levels of professional ability shown here with the physician's assistant, the nurse practitioner, the manager, there's a mental health person or a community health person. I can see having all of your various
Think so.
staff people that work part-time and everything, support staff being in one line, but I think it's important for the public to know the professional people that are in these offices.
In other words, the way we're doing it now is just fine. Now that I
Yeah.
understand.
Sometimes I
I'm
don't-
sorry, guys,
No,
but
it's okay.
this is what this is for, right?
And we all don't speak the same language, unfortunately, so,
Let's ask Tyler.
Now, the main challenge is next year, will I remember any of this, right?
I still don't understand because we were asking about the 7.05 FTE.
Right.
I made a note that I think we need to sit down and verify FTE for these positions and then make sure that they're correct.
Yeah, that's the only concern I have about lumping a whole bunch of part-time people together. Is it really 7 FTE or is it 6.75?
I add all these.
6.7.
There's 11.38
It's not
there.
200,000.
And that's
a
Here.
year.
19,
They're part-time, some of them are part-time.
19 something.
I know
Doesn't
FTE.
automatically up.
I know it, but that's where we need
Yeah.
to go through and scrutinize those FTE because
Times-
when I do
yeah,
my,
times
when I do my.
$40,000,
I
it
have
should
to
be
put
more like
FTE on there
280,
if the
300,000.
FTE doesn't line up with
Well, they're on
within the
clerical.
fund itself.
So they don't make
Yeah, but-
big salaries.
But $40,000?
Well,
Times
$30,000?
360,000.
I mean, that's the other thing that we don't know is how much are we paying these clerical people? Are we paying for each FTE? Are we paying 30? Are we paying 40? Are we paying? I mean, we don't know.
Bobby, in that, the community health worker put 1 FTE in there.
And then we'll go over the salaries.
Is that a full? I have a 0.33 on that.
Yeah, for 20,000, it's gotta be a
She's a-
partial.
She's a full-time
It's a
employee.
one.
Yeah, I'm sorry. I just
I have
appreciate.
point.
Or she's over on the other side though too.
She's, see, I have her as a full-time person.
I have 0.30 from Bill from.
Okay.
And that, is that what you just told me?
I said 1, but that's fine, because you never. I don't know how to calculate them.
Yeah.
I mean,
Well, the way you calculate them is you take the number of hours worked for that person in that position and divide it by 2. Well, they're 40-hour a week, aren't they over there? So it'd be 2,080 hours.
Yeah.
And that gives you the FTE number.
But that changes probably with every day that they work. doesn't it? It's like a moving target. They might be at 2% here, 3, 4, 6,
and next month could be something completely different, so.
But overall, their FTE, for the number of people that they physically have working should equal, in the budget, should equal their physical number.
Right.
The salaries FTE number is incorrect.
Yeah, we're gonna have to relook at those, cause that'll affect in my LB1.
Yeah.
When I do my LB1 after this, I add up all the FTE,
Yep.
it'll show higher than what we actually have.
It'd be nice to have a separate column just for on this budget, if you want. And the PERS is sus on this, too, but I think we're.
Dan, is there any way in Tyler that you could run a report that says all these employees, say, just saying the rural health thing, their total salary for those people is this much. And then that's makes their PERS and all that. Can you run something in that so that you can see if these figures are right?
I can run a employee list with salaries on them. Yes, but didn't we calculate though on that big spreadsheet, you split every, so we have a spreadsheet for each employee over there that splits their salaries between the two, so. But yeah, I can, let me,
I don't want, I'm just thinking for you guys for East to see if this matches what is really true. If there's some error in the transition from whatever that part of the program goes to here, that's making it not right, the right now.
I remember way back during the budget crisis when the public health director at the time was speaking to the, maybe it was just the county court, it might have been, and she said, well, these grants, these different things, they come with, obviously a work requirement that someone's got to do it, this and that, and the more she spoke, the more I realized it's a burden to have all these little, if you just have a small staff, right? And I said, well, what I don't want you to do, any of you, is to apply for things if you don't have the budget and the personnel to
That's
carry it
what
out,
I was
and that
supposed to-
amount of money
I
doesn't
didn't do one
cover it.
for,
I
didn't do one
know
for public
all these
health
programs
or
have
HC.
some benefit, but we can't do cocoon, we can't do TPEP if
Because
it's not.
because all this is so convoluted.
Viable
There's no
for
way
us
for
to
me
do
to
it on
do that. I just
our
had to
budget,
basically
then
rely on them and they're
this is what
split.
you have to
That's right.
do. That was what I was saying is, there's all kinds of things you can do if you have the capacity to do it. But sometimes it's not worth it.
To be quite honest, on public health and RHC, because it's so dynamic in how they bill and all the different programs that they bill specifically to because of Modernization and Healthcare Act, that's really the element that causes all this, the dynamics in this. While we obviously need to review the PERS, but for the most part, at budget time, I take the numbers they give me.
Yeah.
I have to.
They're the experts, and they're the ones I think she does a really good job, at least what I've seen. She knows her stuff.
Well, bottom line, their beginning fund balance continues to grow. So yeah, so the bottom line is, and if you look at the bank statement, their cash amount continues to grow. So until I see some kind of concern that's not growing, I have to take, because I'm not a healthcare specialist in all those programs and everything in order to be able to monitor it and keep track of it. So it is seriously an element of trusting what they give me.
No,
A year from now, they all be different.
It could. Medicare, Medicaid, health modernization and healthcare funds, all that could be totally different look next year.
With the understanding that we have to look at PERS and stuff, I moved to tentatively approve the rural health producer.
second.
moving on.
A motion has been made and seconded to tentatively approve Fund 245 Rural Health Clinic Department 050. Any further discussion? All in favor signify by saying aye. Aye, and opposed? Then hearing none, motion carries. Next fund up is 250, road department operating reserve. We could have done that one at the same time as the road department, but just going in numerical order.
Why did we budget in 24-25 to overdraw our total available resources?
So you're talking about as far as revenue would go?
Well, yeah, the total fund expenditures are 8.6 million and the total available resources are 8.8. I guess it wasn't an overdraw, but it was dang near the whole fund, which left us with a budgeted projected ending fund balance of 262,000.
So the weird thing about this is some of these reserve funds had this line called unappropriated ending fund balance. So that there was like a transfer built in for the road, the 1.454. And then the balance was put in the unappropriated ending fund balance, and we shouldn't even be using the category, which we are not this year. We have a note, but we're not using this one anymore. And also school vote after 3 years. So that figure was put in there just to but we shouldn't have been using those, and so we're not doing that.
So that's why that figure would be so big, that
The 7.2,
was,
yeah,
that's
that's just.
8. I'll
So,
let Rob ask. I'll try not to.
so the,
Oh,
so the beginning fund balance for the budget for the year we're in was 8.6.
Mhm.
The revenues and for the resources were 8.8. That's, it looks like the expenditures are 8.6. But that, it's because that figure of 7.2 was put in the unappropriated ending fund balance.
Okay.
So it's unappropriated money. I don't know the history behind why these lines were created in these reserve funds, but historically a figure was put there when it just shouldn't be. If it's unappropriated, it's just unappropriated.
It just goes into the ending fund
Yeah,
balance.
so we're no longer using those lines. I know I'm repeating myself, it doesn't make sense what I'm saying.
yeah,
Okay.
but then I don't understand the beginning fund balance budget of 7,545,000. I don't understand where that number is coming from.
That's our.
Estimated.
Our estimated beginning fund balance, our guess, our budgeted figure. If we were to use the rest of the road transfer, then it will bring down our actual balance and we'd be about that figure.
So there's a planned and or a budgeted for this year for 24-25, a transfer from this reserve fund to the road department fund of $1.454.8 or $800 million. We only transfer what's needed. If they only need $1 million, then $1 million gets transferred. If they only need 500,000, that so that beginning fund balance at this point right now of 7,545,000 is a best guess on potentially what could be transferred by the end of the year.
But you're proposing only 370,000.
For next year.
For next year.
Yeah, so the beginning fund balance is just based on, if we were to use this full transfer, we think that that's the amount left.
Because 24-25 is not done. Right.
When it gets to June and the treasurer can see what the actual ending numbers look like to keep it whole so it doesn't go into the red, she'll transfer what needs to be transferred.
Cash balance is like 8.2 million, but if we end up having to transfer another 17,000 and reduce that amount, which I figure is potentially low, but all these beginning and side budgeted figures, I did in February, so it's
Oh,
hard, yeah, to the next. really, really close. Okay, you can see.
Ooh.
Needs to know.
It's okay because some of this stuff, the treasurer and I have gone round and round on some of this stuff until I got my head wrapped around some of it too. I think she got pretty frustrated with me here about a month ago because I just couldn't picture what she was saying. We don't.
But we understand it.
I understand myself.
Your head, Bill.
I understand myself.
See, okay, whatever.
Nod your head.
I take your word for it.
And then, yeah,
Has to crunch.
You don't like that beginning, the budgeted beginning fund number?
Well, your beginning fund is the same as your ending fund from the previous year. I get that, and I get that you don't use our actual because we still have 17% of the year to go. And so in most of these cases, we used our budgeted projected ending fund balance, but this projected ending fund balance is jacked because last year we took $7.2 million for the unappropriated ending fund. So I guess we're just making up our best guess for what the beginning fund balance.
So right now, like the beginning or the cash balance is 8.2. If I transfer another $700,000 out of that,
to cover expenditures in the road department.
we reduce that to $700,000, which is around 7.545.
I understand where you come up with those numbers. So
And next year, well, I mean, budget you guys are looking at now, we don't have anything appropriated in unemployment.
We'll stop using those
Stop
lines.
using those lines. So it won't look as though we're actually have that many expenditures budgeted.
It'll look like all the other funds. And what the ending fund balance is.
I would sit there beside you and not pass. So I don't know who is.
Oh, you got cantaloupe in there?
Yeah.
Oh, I haven't had
Thank
any-
you.
that's what you get too excited in there is the fruit.
I haven't had any cantaloupe in forever.
10:30, do we need to take a break?
Just a cantaloupe break.
We're just transferring.
These chairs are killing me.
You want to trade?
We haven't got very far.
I've actually looked at the bills to see where the cash fund balance is, if they need this money, we move it, if we don't, then we get paid. And they're actually doing okay right now, yeah, but so we need to.
Oh, did you already go to the bar?
The bar, yes, I did. The brunch bar.
Yeah.
Real evidence. I might go back.
Figured out?
You still thinking?
I'm thinking hard.
Better go get some sleep so you can think better.
There's lots of stuff that's not fruit in there.
I know, I have to face myself.
Goodbye, cantaloupe.
Don't trust it.
I've got seeds growing for it in my garden.
Do you?
I'm excited.
Did you grow it last year?
Mm-mm.
Okay, because I wonder, I don't know if you grow it. I'd be interested to hear.
We're gonna try, and I've
Good,
got
well,
some
keep
weird
going.
things being built in my garden to facilitate it.
My daughter's grown up, he's gotten several that have been about
Oh,
that
really?
big. They are so good, yeah.
Oh, yeah.
Debbie, why don't you press cantaloupe?
Well, because half the time it doesn't have any flavor or it just,
I think
it's not right.
really
or-
good organic, no
You need to let
GMO
Doug-
and
Hard to
everything
find
else
a good
tastes good.
cantaloupe and then you waste your money.
You need to have Doug.
Products in the grocery stores tend to taste like very good homegrown, just like tomatoes and everything else. They don't hardly
Even
even
this.
flavor.
Well, I don't like
I
having to
agree.
sprinkle my own glyphosate on it. I want them to spray it on.
And it
corn.
doesn't taste. Doesn't have much, cantaloupe doesn't have much flavor in it.
Some else still do home visits. Yeah.
Yep, they're visiting my brother-in-law. And we kept the road plowed for him, by golly,
How's he doing?
Dave did, about the same.
Okay.
This is mine.
Ones.
They added, unless I missed something here, or I'm sorry, this is what I added up from here. This is what I added up from this list.
Our total salary.
For what's put,
Wow.
what it's set up in there. As.
For their true salaries.
Mhm.
So are they budgeting way over?
It looks like it. Because
This would be their actual salary?
that is, that's what is set up in Tyler right now. But again, being hourly,
She wasn't, I mean, she rabies and the pilot.
So that's
But she said.
$219,000.
to do it percent on her.
Point 4.44.
Then a lot of like.
Right?
Don't have to
Between
have
4
work.
point.
No, I'm not talking per, I'm talking salary,
Massey.
just times 3%.
Oh.
Yeah, this isn't good cantaloupe either.
I just sort of went on, so a little more.
That's it.
Lot longer than.
It's 945,000.
And
Yeah,
What's the difference between that and 1.25 million?
it's a difference. What is chili?
It's 1, 2, 5.
well, I imagine pesticides and herbicides and,
That's why one of the big regions is in.
yeah, I don't know if this is. You know, like they made it so that a lot of it is preserving the food so it lasts longer. I buy a local brand, Dave and I don't eat a lot of bread. You buy a local brand, 23 years old.
I mean, that was really high.
Anymore.
Yeah.
Never
They're
does.
over.
We can have it
They're
for weeks and it
over
never,
calculating their salaries.
does that tell you about our bread?
Hers,
I have.
they don't actually make that much salary, then that hers would probably be enough. But in one line, they're flavoring, in another line, they're not.
That's just a guess.
Yeah.
Yeah.
Oh, my God. My mom's English.
Yeah, it's ridiculous. Lisa makes 2 loaves of bread every weekend for them. We make bread, you know, as often as we can squeeze it in. Dave's main bread.
Thanks for printing it all.
Yeah. Yeah, that's part of it too.
Yeah, yeah, and same thing.
At one time, we planted wheat and grew it and combined it. And then we bought a milling thing. And we just found out, you know, flour. So it lasted a little while, but I mean, that's pretty labor intensive to get a good loaf of bread.
Because I know my body.
There's some Mennonite, maybe it's milling her own flour and make some bread. I keep asking her, when I spice some flour? And she says, oh, you meet the guy at the truck stop once a month and he brings the wheat.
So not,
berries."
not at this.
I keep saying, no. And I, well, you make me the flour. I don't wanna be grinding flour. Once you do it, she won't start selling. Wish she would.
Yeah.
Really want to start going down the rabbit hole, you'll see all the folic acid that they spray on bread
Everything.
products. But half the population, like 40%, has a gene deficiency, so they can't break down folic acid into folate. It causes like crazy mental issues.
Oh, God. That's what we need.
That's it. That's my problem.
Gotta get that full blooming.
No, we just don't have a clue what's in our food.
I literally, that was my problem. I was like, I think I'm going crazy. And they were like, oh, it's because of this. I was like, oh. So
We ready to continue?
let's do it.
Okay, so road operating reserve fund. We clear as mud on it.
Who's tracking the transportation bill? Is it looking okay at the moment on what counties get?
Oh, 50, 30, 20 stuff?
Yeah,
I don't know.
okay, I just didn't know. Okay.
I guess the bottom line is right now we have 8,229,000 and some change in this fund, depending on what ends up being needed to cover the road department's expenditures for the remainder of the year. It's going to end up being somewhere between 7.5 million and 8.2 million. In the road department's budget this year for this one is where I split up the transfers between the reserves so that it reflected the needs, not just all from the operating reserve. If they dip into the operating reserve every year, then the other two reserves, which are for equipment and for paving are the other two reserves. Then maybe down the road, when they need operating reserves, it's not going to be applicable to equipment. You know what I mean? So if we expend all the operating reserve first and all we have left is paving and equipment, but they need actual operating funds, it wouldn't be applicable to take money out of equipment to cover operating. So I divvied those up into 3 separate transfers this year to reflect that so that the operating reserve is 370,000. The paving reserve is 400 and equipment is 500. And that should better reflect their actual needs for dipping into the reserves. One combined between all 3 reserves too, and this is while all 3 reserves are getting a pretty healthy interest return on them right now. If you're dipping into one reserve, such as the operating reserve for those total needs, it's only getting 250,000 or so in interest. And the other 2 reserves are building because those aren't being touched. So theoretically, next year, if it earned about the same interest next year at $250,000 and they did need the full 370, they'd only really be dipping into principal by 120,000. I think it's just versus relying on one reserve to cover all their needs, then you're left with the other 2 that are specific for other purposes. So that's why I did that this year. Any further discussion on Fund 250 Road Operating Reserve?
On 250 road operating reserve.
A second?
A motion has been made and seconded to tentatively approve Fund 250 Road Operating Reserve. Any further discussions? All in favor signify by saying aye.
Aye.
Aye. And opposed? And hearing none, motion carries. Next fund is 251 Home Health Hospice.
I just have one question, general question on revenues, federal sources, Medicare. I know, I imagine they just have to best guess it, right? On what they're gonna get. And, they're best guessing it. You
Pretty
know,
close
more
to-
than 100,000
Well, they're,
last year,
Well,
but, hopefully that's true.
that's a 3/4 mark. This year, they'd already received 230,000.
So
Divided by
that, I was just,
three.
comment, but it looks
Plus
really good. I mean,
30.
I think they'll keep their expenses down as best they can, pretty steady. They do great work. And
So on the same trajectory for the last quarter, because this was printed first of April. So that would be April, May, and June, 1 full quarter left on that same trajectory. Based on what they've received right now, it would come up to about $306,000. So they've budgeted at 350. I mean, they've got a lot of patients going on. They're really busy over there. If it doesn't come through to that 350,000 as far as full expected revenues, then that's where the transfer would come in from RHC.
okay, looks good to me.
So there's two separate departments here as well. There's hospice and then home health. Yeah, we do these separately. You can see their materials and supplies is minimal increase, 15,000. Yeah, $15,000 about.
so on hospice, there's a CNA at 0.25. And I show last year it was 1.5. Is that right?
But I didn't change that number, so it should have been the same as last year.
With this one?
That seems so weird.
So are you on the hospice or home?
Hospice.
It's hard to see because these were changed last year and I lined through them, but, well, it's CNAs plural on here. CNAs plural. It said 1.56 and I lined through it and changed it to 1 based on what we decided last year, and now this year it's at 0.25.
Well, it's 0.25 here, 0.75 here for one CNA between the two.
Home
And,
health.
and we are getting ready, yeah. we're
Oh, it's
getting-
in another, the
Yeah.
other 75.
Yeah,
75 is-
in home health.
Hospice split everything,
Okay.
25% hospice.
It's a same staff between both programs, like the RHC and
And we're getting ready to do an interview next week, probably on that position.
Oh, and they're not right. I guess there's just only one CNA and there were more last year. I guess that's my question.
We've had more in the past. I can't remember whether it was last year or not. But right now we have one CNA. Going to have another CNA very shortly.
This comes out, it's almost dead on. The PERS. So I'm wondering if it's the numbers that I got from. The numbers that I got from. Kelly. It's one stuff in it. It's not Tyler, I just put them.
Right, which we talked about that.
Yeah.
Because it's so, they have it kind of nailed down, but.
Hers looks good on this one. I just did the rough calculation, comes out to 42,4 something in my calculations, and it's 42,4,670 in here, so I'm good. I'm comfortable with that. Hers calculation.
So how many total staff do you have in home health and hospice?
7.2. Split between home health and hospice.
I move to tentatively approve Fund 251 Home Health Hospice.
Motion has been made and seconded to tentatively approve Fund 251 Home Health and Hospice Department Fund 051. Any further discussion? All in favor signify by saying aye. Aye. And opposed? Hearing none, motion carries. So we'll move on to Fund 251 Home Health Fund 055. Or Department 055.
I move to tentatively approve.
I thought we just did both.
I did too. We were gonna both at the same time.
That's what I thought I was doing.
Yeah, I did too.
I'm just treating them separately as separate departments like we have done on the other ones. Motion's been made and seconded then to approve Fund 251 Home Health and Hospice Home Health Department Department 055. Any further discussion? All in favor signify by saying aye. Aye. Opposed? Hearing none, motion carries. Next will be Fund 252 Fair. The fair is also two separate departments, one being fairgrounds operations and fair. So then Fund 252 Harney County Fair, Fairgrounds Operations Department 051.
I had a question about the grounds maintenance line, materials and supplies. It's a lot higher than it has been. Double.
We haven't had a caretaker.
Are you talking payroll or materials and supplies?
Materials and supplies,
Oh,
ground
okay.
maintenance.
Grounds maintenance.
Not. For the bathroom that you guys just did. During, that we did a resolution to.
Yeah, but it increased from 24-25 from 30,009 to this coming budget year of 75,000. An increase of 45,000.
More than double. What is this, what ground maintenance are they doing? Just all ground maintenance because you don't have a caretaker? Is that?
We
what
do
you-
have a caretaker.
Oh, you do have a caretaker
now,
now.
but we haven't up till like,
So it seems like that should go down before it goes up.
well, this is
Those
whatever
are
project
those
they're
are-
doing.
Yeah, projected repairs.
This is whatever they got going out there.
There's nothing left. They tore it all down. There's, what's to repair? I guess that's part of it too.
The memorial building stuff.
You know that your office, or we read their offices. Yeah, that's a good example.
Oh, that's it. Okay. I'm just hoping they don't quit. Yeah. Coming in.
But I do
It's
know
not
that-
registered.
The the water system, the plumbing system is very bad over time. Hipper's building is almost not habitable, but it is for an office. I don't know.
Will you take it?
Yeah, I don't have a
When
full
they're-
breakdown of what their projects are for the year, what their planned projects are.
Salary to them, exit from the family, which kind of is.
Yeah.
We don't have anything to put it, but we have to put something. We might have something. Yeah, we just don't want to.
Right. I think she puts. Or.
Are you advertising for a new manager?
For, no,
You heard that they were?
Hmm?
You heard that they were?
No, I
Oh.
don't want to. Who's the their manager is teaching and everybody knows.
Oh. Well,
It's an
Dawn,
HR issue and not this venue. So, their budget is primarily based on their receipts. With the exception of $150,000 that comes from the general fund and the park fund.
So, just for our general awareness, what's the RV, park status these days? Is it fully operational?
So it's operational. They purchased fire pit rings and tables last year to be in compliance to receive the RV registration fees that we get from the state. It's about $30,000. It's projected, I think, this next year about $30,000
Is that reflected in the budget somewhere?
in the park fund budget.
Oh, okay, right, stall rentals, I see that, we're hoping for 10,000, which might be about right, I guess.
The bulk of that money comes like from there when we rent stalls.
I know that once the new fair event center and everything is up and running, they're anticipating, the future, getting more revenue from stalls rentals. I keep hearing that. I don't know.
So
Do you go to those meetings or?
Yeah, most of I think most of the stall rentals are rodeos.
Yes, that's it. I'm sorry.
from what?
Rodeos. And so like last year in May, the end of May is when we got like $5,100, which is the bulk of the.
From like high school rodeo.
Last year.
Yeah.
Yeah, from the high school rodeo. Because there is stuff.
Additional revenues for grounds rental this year. You see that under actuals for this year's budget is $210,000 budgeted. It was budgeted at 18.5. That's payments from the fire camp out there this past summer. And then I don't know, is the emergency management side of things and Red Cross shelter out there, Rob, are they getting anything for that, or is that just donate towards the emergency?
It's the emergency,
I didn't know if Red Cross provided any.
not to my knowledge, and I've asked about it, not as directly as that, but to my knowledge, it's just the way emergency.
Okay.
And also Patty was asking about the RV park, but so I don't forget, it's worth bringing up the Burns City Councilors seemed like they would be open to a conversation about those utility fees we talked about, because each faucet is a point of access, and they were unaware of that. It's ridiculous.
They've been aware of it.
Well,
We've had
Maybe they're
that.
feeling better
We've
toward us
spoken
lately.
about it. It's-
That's ridiculous.
$14,000.
We've been having that conversation for 2 years. on that topic.
We'll keep poking. That's silly.
Got a question on the state sources of revenue, the OREM HVAC grant. So are we still expecting that? To
So
come in?
you must be in the fair part.
Oh,
Or you,
sorry.
Fairgrounds operations.
yeah, I thought we were just looking at fairgrounds
Yep.
operations.
Department 051.
Oh. Yeah, that's what I'm at.
At the bottom of state sources.
11,000.
Yeah, exactly. Is that anticipated
Oh,
to
I
be
see.
received by the end of the year, do you know?
I think so, when we talked to Lindsay about her budgeting. I mean, we would have asked her about, was it going to be budgeted for next year if you're not gonna get it, and she didn't put it in for next year, so hopefully.
On the transfers, so maybe Judge, you can just talk me through why the amounts were chosen for the.
So the last couple of years, you can see the transfer from general fund was $120,000. They requested more out of the park fund this year, which I did initially. And then as I was developing the proposed budget and until we had revised the beginning fund balance, I had to scrape and cut and do whatever I could do. So I decreased their transfer from general fund to 87,000 and increased the transfer from park fund up a little bit and ended up with 152,000. But they will this year in projected revenues, get $13,000 from the RV park, which is an increase. I mean, last year it was actual for this year 6,500. Last year's actuals was 11,900, 16. So they'll fall somewhere between $12,000 and $15,000 in that line.
Which is basically normal, right? It's basically a normal figure.
Yeah, for the last several years anyway, that trending.
So we really don't know the specifics of the 75,000 of the grounds maintenance then. We just,
I don't have a project list, no,
yeah.
as to what they planned on doing with it. But the bleachers, the concession stand buildings, the memorial building, the other buildings in back, stalls and whatnot, arena.
So the grounds maintenance includes buildings maintenance and it kind of includes everything out there.
That's the way I would lump it
Okay.
all in under grounds maintenance, whether that's repainting the grandstands or buying lumber to fix the grandstands or
Well, sometimes building things turn into capital outlays, so that's.
there's no other capital outlay out there. And as we get even the equipment purchase for capital outlay, they bought a new tractor last year. So it went from 85,000 down to 15,000 this year just for any potential needs.
55 was a tractor.
85.
Well, I'm looking at the actual.
Oh, yeah,
I'm assuming they bought it.
yeah. It was budgeted at 85, so.
Yeah.
And actually, I think they paid for that half the previous year, didn't they?
Yeah.
They paid for that tractor, half of it in June and half of it in July last year or this year. Whatever, this fiscal year.
That's why so the 51,508 is part of that tractor as well as the 55,039. It was $110,000.
A payment to Robin's equipment in the previous year.
Any other discussion on fairgrounds operations?
Second.
A motion's been made and seconded to tentatively approve Fund 252 Harney County Fairgrounds Department 051. Any further discussion? All in favor signify by saying aye. Aye. And opposed? Hearing none, motion carries. That will take us to 252 Department 052 Fair.
I've got a question on revenues. The first category, these fines and assessment, the last line, refunds. It looks like this year in actuals, we've got 32,000 in refunds, and we usually have that line 0. So what was that?
We created that line this year. We've got payment in October. This 24, I have to go look.
Was this,
But I mean, they received a reimbursement for something. And I'll look.
Fiscal 24 rodeo. It just says rodeo. Fiscal year 24.
so is there a line where private donations are receipted in? I know that was a topic for a little while. I'm not sure what the latest is.
We have not created one, no. And I know that we have briefly talked about it at the Fair Board meeting and but I don't know. This is all between the Fair Board and whoever potential donors. I don't have any idea on amounts or dollars or anything.
And are we,
But by budget law, donations become public funds and have to be accounted for, so.
the thinking is from the Fair Board perspective?
In that particular,
The amount, we paid out the full amount of the rodeo budget, and that is the amount that was returned. So they have a rodeo secretary contract with a gal who does all the payouts, writes the checks,
Okay.
and she was paid out the total amount. And 32,279 is what was returned, that was not for payouts in excess.
So instead of paying out as needed, it was dispersed all at once. And in order to take it back, there had to be a line to receipt it into.
Do you get the receipts for what was paid out?
Thank you for looking that up. We're talking now about how to receive private donations, people who want to donate to the fair. Fair Board is involved in doing that and open to that, of course, anytime. Did that get a line anywhere?
I don't. If there's not one here, it's not one that's been requested. There is the Fair Board Memorial Fund is set up to receive like in memory or it says memoriam donations. I haven't received anything into this fund for a very, very long time. But with the previous fair managers, I think this is where we would receive monies into. I think at the history. If they want to hold that money separate, that would be my suggestion, is to put it in the.
Well, and there's more than people could donate to the fair or they could donate to the construction of the fairgrounds, which is
Right.
two
There's
different things. And so
Yeah.
you kind of have to honor the donor wishes on that and keep so that they go for what the donor wants it to go for.
So we haven't received anything into the donations line since 2021.
Was that a specific like memorial fund that whoever established it said that it is for, you know,
So
this or that, very specific?
there's a note in here, which Judge Harder has been trying to do as we come across the resolutions for all these little funds, but like all the money is placed in reserve, which is the 253, shall only be spent for the operation and maintenance of the Harney County fairgrounds. So that's how that fund goes correctly.
Okay.
If the fair board is wanting to look for donations and a little conversation to build that in, however, that needs to be. Would probably be a good idea to do it now instead of waiting for that. If we, know.
Well, you were starting to say.
Oh, just based on my understanding of tax law, the local government can take donations and write a receipt so that they can get the charitable contribution for their tax write-off purposes. An issue came up where someone was from Central Oregon was wanting to donate to our emergency stuff and they weren't sure where to put it. And my advice was we can find a place to put it. If someone wants to give us money, take it. Well, I think if you don't have a special fund like this Fairbold Memorial Fund, if someone wanted to donate to the operation and maintenance of fairgrounds, it could go in there. If they want it for something else, we'd have to find the appropriate place to put it and then just be judicious about how we spend it, because all donations do become general fund and anyone could access them, but in keeping the faith, you just have to make sure they get spent and are accounted for the donor, which
Do they have to go to general fund?
they don't have to go to general fund, but if it goes,
Because like say if somebody wanted to donate towards the construction of the event center, we have a fund for the event center, so I would put it in
that's where it
the,
would go.
yeah, that I would put it in that fund.
I am unsure. I don't know that legally speaking, it is illegal if $250,000 donation comes into that and we pass a resolution transferring to the general fund. I don't think that's illegal. It's just not very morally or ethically correct.
I don't think we would transfer out of the fairgrounds in this.
Right.
Yeah, but you mentioned that I may have to do some research on that and see where, if there's any regulation on where it has to come into, if it can come into, like, say, the event center fund, or if it has to go into general fund, and then we would have to do a supplemental budget or something to transfer it out. I need to, you mentioned that, I want to say, it seems like I've heard something along those lines, so I'll have to check with DOR and find out if we can reseed it into any fund, or if it has to go into something like specifically the general fund and then be dealt with from there. That's ringing some bells for some reason, so I need to research that.
And for the revenue in the future for the state sources, the odds of some legislation going through that would more than triple our Oregon lottery disbursement is really looking
Yeah, I
optimistic.
hope that comes up.
Because when they passed 1% of Oregon lottery fund was supposed to be to fairs specifically, evenly distributed between the 36 counties. And then they put a cap of 5 million or 50 million. They put a cap on it, and it's significantly less than the 1%. And so they're trying to get rid of that cap because the intent was that 1% of that lottery money goes to fairs. If that happens,
Who put the cap on it?
the legislature did several years after they originally did the 1% of lottery funds.
It's law then.
The legislature,
did it,
they
it's law.
take the kicker away, you know what I mean? They just keep. Question on the transfers, from 326 Fairground Reserve that 43,600, is that cleaning that fund out, or is that just an amount we chose last year, or
It's
what?
probably close to the balance, but that is only done with the requested. But it could just-
No, there's more than that in that fund.
Two.
But we received a payment, I think that's the one where we get the betting money.
Yeah, is that gonna be the annual dispersal?
Mhm.
We will- we will get- we will start that, yeah. That 326 has to maintain a balance of $15,000 and can only be used to fund capital improvement projects. And so that's probably why that amount was selected, is to leave the ample balance in there.
Okay.
You can see I have that note in there.
Yeah, I appreciate that. That's good. Okay, thank you. I just, that's a one-time thing, right? If we do it in the future, it'll be for a lot less. Transfer.
Yeah, I mean, if,
I mean,
I think whatever they requested for.
it's if they need a request to it. It would just, we would have to leave. For 15.
I'm
I don't know.
surprised with everything that going on that they didn't request anything, but
Do you know if they've started the process of applying for that really big grant? That, was it already?
With
when's
the
it-
matching,
I don't know.
yeah, it's like $4.5 million grant.
Is that? what is that line?
It's supposed to be a matching.
I don't know.
What did, here's that, how that's going someday.
What will happen in that, is it 326 in the reserve? What will happen, there's like 9,000, there's 24,000 left in there. So what will happen if they take 9,000 for capital improvements and there's 15,000 left? And they has to maintain a balance of 15,000. Will that money just have to sit in there indefinitely? Because
Would the court do a resolution to
Yeah.
change the parameters of the
Change,
fund?
do a new resolution, spend it out and
like the
do
latest-
away.
So
That's
what,
right.
what was that again? The balance of 15,000?
Yeah, it's only 15,000 left in there. I guess we have to do a resolution to get it out of there.
Yeah, if you delete a fund, then that money has to go to the general fund, doesn't it?
If you have a fund with residual that. Yeah, like that's what we did with the ELC cut, but like, I would think in this. I don't know without checking, but like, you could do a resolution to change the parameters of the fund and then utilize it for what you want.
Draw it down to zero, be able to draw it down to zero. But this is the fund where those annual proceeds are going into, so it's gonna be a number of years. We'll need this fund for some time to come.
It's about bringing.
Did it just come from fairgrounds operations at some point, or did the county create it specifically, or
Which,
15th, that reserve?
the 326
Yeah.
reserve fund?
That's where the donations. So
Yeah.
Yeah,
in theory, a reserve fund would be the most appropriate place if they become profitable to put their excess. But if they can only use it for capital improvements, that might be not ideal.
well, I believe the provisions of the donation that's coming in here was based on that stipulation, that those funds had to be used for capital improvements. So until
Oh, that's
that,
from that fund that has to stay at 15,000 came from her.
Well, originally, I don't know where the funds came from, but currently we are now receiving an annual payment from the trust.
And it gets receipted in where?
Into the 326 and then donate the donation.
Oh,
I move we tentatively wait to see fair as presented.
A motion has been made and seconded to tentatively approve Fund 252 Harney County Fair, Fair Department 052. Any further discussion?
With the entertainment for 24-25,
The revenue or expenditure?
the expenditure for entertainment, did we have entertainment last year?
I didn't go.
There was a
I didn't
band.
go either, so I don't
think
know.
so. Let's look and see. I know that,
They had they have the inflatable stuff,
Bounce
right?
house and.
Oh,
Stuff
so it was
like-
like carnival type stuff?
And the
They-
performance. Higher.
yeah,
Yeah.
it's kind of a combination.
Oh. Cause I
Yeah,
don't
so
remember
like
them.
bouncing bins. Chad, all of the like musical entertainment. And then like talent show winners come out of there.
Okay.
Sound.
And they're planning to spend more. Have more entertainment, I guess.
It's
Okay.
like the first donation that came in into that revenue donation line was in 2013 for 50,000 from the Mike Morgan Trust. That's the farthest back that I can see.
Any other discussion? All in favor signify by saying aye. Aye, opposed? Hearing none, motion carries. So we already took care of the Fair Board Memorial Fund. The fair bat stock sale is zeroed out. Do we have to keep this in again for like 3 years until it's all, or is it actually part of the?
I think we just have to show it in our records, but I think you guys don't remember.
Does it need to be part of the budget package as a whole? Okay. So
And we do make a note, we need to do a resolution to dissolve the fund.
next fund then will be Fund 256 Hospice Memorial. Projected beginning fund balance of $70,000. Projected expenditures of 50,000. Estimated ending fund of 26,000.
How do they use those funds? It says that it's healthcare for those who do not have necessary resources.
It's like if they're now homebound and they need a walker or they need a potty thing or, just stuff like that. And they do try to, they have a shed where there's some of those things that have either been donated or returned. And, any way they can help like that. When people have nothing and they need it.
Well, and I think they've also made baskets up that'll have socks or, other odds and ends things, chapsticks and Kleenex and odds and ends like that they provide as well.
The funds this year, the 22,000 that was budgeted during this current fiscal year and actuals of 21,574 was for a machine that uses to measure wounds. And it's kind of like an infrared looking type of a picture or weather satellite picture. It gives different variants of colors. That's, I think, heat, that comes. So it can measure the wound as a whole and track it. So they take a picture of it basically period once a week or whatever, and it tracks the healing of the wound, whether it's getting worse, if it's staying. It's a handheld device basically.
It really
Yeah.
helps them a lot.
But that's-
They're in someone's home and they're trying to figure out how it's going or even originally,
But that's what they used it for this year.
They do a lot of wound care.
Yeah.
A lot of.
Any other discussion on the hospice memorial?
Move to tentative approve hospice memorial 256 as presented.
Second.
The motion has been made and seconded to tentatively approve Fund 256 Home Health Hospice Memorial Fund. Any further discussion? All in favor signify by saying aye. Aye. Any opposed? Hearing none, motion carries. Road Department Reserve Fund 329. We took care of 258 last time. 259 last time, or beginning of the month. School. County school, we took care of. Jail reserve, we took care of. Fairground reserve, we took care of last time.
Oh,
Or we just did that one.
We did road department and road pavement last time.
Did we do them last time? 329.
Yeah, equipment reserve and restoration.
We didn't do that one, did we?
No, we didn't.
No. Yep. Okay, so equipment, Fund 329, road equipment reserve. And again, I kind of spelled out already from their fund as to how I divvied up the potential transfers. So other than that, and you'll see there too, that this is one of those funds that previously had that unappropriated ending fund balance in it. And we're not using that this year, so it'll just reflect in the actual ending fund.
I move to tentatively approve Fund 329 road equipment reserve.
A second.
A motion has been made and seconded to tentatively approve Fund 329 road equipment reserve. Any further discussion? All in favor signify by saying aye. Aye, and opposed? I'm hearing none, motion carries. 340 road pavement restoration. And again, same thing as I've already previously explained. No unappropriated amount. Reflect in the ending fund. So between those three, just for general reasons, there's 4.7, 2.8 would be 6, 7.5. And what was 250? And 250's projected, so we're looking at about $15 million in reserve funds for the road department.
Not really expected to be used.
Oh. It's not to be used.
Yeah.
Get back and look about because,
Yeah.
well, not with the inflated expenses that he has.
So thing that in the road department fund, if I didn't mention it, the roadmaster basically did two separate budgets. He did one, and the one that reflects in the book is if we got the SRS funds. But he has a work plan and a secondary budget, so to speak, that if we didn't get those SRS funds, then he's not going to do X, Y, and Z, and that'll trim it down to within the means of what we have. So while yes, we didn't get those this year, and operations may look inflated compared to what our revenues were, it's planned for in case we didn't get them.
Well, I didn't really get to look at that as much yesterday as I wanted to, so I'll have to go back and look at it. And look at the transfers and stuff a little bit more.
So I tentatively move to approve Fund 340 road paved restore reserve.
A motion has been made and seconded to tentatively approve Fund 340 Road Paving Restoration Reserve. Any further discussion? All in favor signify by saying aye. Aye. And opposed? And hearing none, motion carries.
This has been the least hectic budget season process in my 8 years.
Speak for yourself.
I am, but
I know I asked yesterday, but I had goldfish brain. Where can a person see the economic development department?
Are you talking about lottery funds? The two.
For our-
funds.
Well, just like for what we pay for economic development, because if I look at Fund 242, the lottery economic development funds,
That's it. So the line is. It's, you know, the 242 is a big piece of the second floor. And we have to do reporting on the.
so, so we get roughly $100,000 a year from video lottery proceeds. And then we spend that money on the economic development department, basically, which is contracted services. And that's the economic development project is what that is.
Yeah, so it looks like
Web,
the money has gone, it
what's
goes
her
to,
name? Cindy? She
Greg
gets paid
Smith,
out of that.
goes to design journeys for the website.
Oh.
The court agreed that it would go for mosquito spraying the last few years. So it is, those are the three expenses that come out of that one. Greg Smith, the website, and the mosquitoes.
And Smith was 84,000.
7 months.
Mhm.
So how come that's not shown as a contracted services?
Mm.
It's the way I inherited it. I mean,
Yeah, it's the way I inherited to it. We just, those are conversations that we just haven't.
Cause that's a little deceptive
Like the
to
first
say,
two that's broken out.
yeah, to see it all as a project when really it's going to pay somebody.
And that
Um,
contract.
I mean, we could just change the line to contracted services because all three of these are that.
Is it up the end of
Do
June?
that. Make everybody
That would
feel
be-
better.
So that would be at least a little bit better, but. But is it an economic development coordinator contract specifically,
I think that
or what?
since we, as a county court, change our model of how we're going to pay for economic development, it changes as we feel it needs to change. Then I think we want to put economic development contract or something and not, specify it in case we change it to a year or two or whatever to, we're gonna spend some on a professional grant, right? Or we're gonna spend some on having an office or not, whatever it is, whatever model we decide to use the money for. Unless we want to keep changing line numbers all the time, I think we just want to think about how we label anything. If you just want economic development services contract, website, if that's gonna be a standard place where we pay for our web services. I don't know, that's a conversation the county court needs to have anyway, but on specific stuff, but like the mosquito contract, for instance, people, I don't know if that's where we want that to be forever, how long we'll be doing that, if that's the only place we could have put it. There's a lot of things that contribute to our economic development, whether it's quality of life, investment in businesses and infrastructure or some type of services.
Well, this just looks like it's spent on one project by calling it that, I think.
I like to see
So-
lights, so like when we're looking at the home health stuff, RNs that are comparable can all go under and have however many FTE, that's the office staff, and same with this, economic development, not different than vector.
And
Yeah, it is.
And the website.
And a website, right?
Yeah, I mean, they're all very different things.
the numbers come out the same either way. If we decide we want to create a line to specify, to more specifically identify. My only concern would be that that's our current situation or our current setup. If we change it next year, then it doesn't really reflect what we're doing next year.
Right.
I think, if it's just, quite frankly, the way it is, it may not spell out that this much money is going to here and this much money is going to there, etc. But it's all related to economic development in one way or the other, as far as quality of life or outreach or services and direct services.
If anybody needs or wants the detailed history of the line, just put the name of the. Well, version. Everybody, well.
If we nail ourselves into a specific category or purpose to specific, we end up doing resolutions to, which there's not that big of a deal, but why create work that we don't need to create?
Could you put something in the notes about how it's spread out?
It is.
Well, it does say that there.
Yeah, it says those three purposes and that is printed with the final copy that's for the public review, and they can look and see where it's. What's that?
Do you do something with the conclusion?
We're starting to get
Um,
Rob's body language.
Hear anything that you said?
I needed to ask once we're done with this. I can't remember. Do we?
Oh, I just, go ahead.
No, finish the conversation.
I'm just curious, what those video $1,000 can be used for, and so if we need that, we should back doing development activities.
Send you the. I didn't, and we'll just report to the state what the money is spent on.
Do those reports refer to whatever ORS you're responding to when you write those reports?
Not that I can recall that. It's basically a one of the decision.
When we were allocating ARPA money, American Rescue Plan money, bank, we we were trying to fill a lot of different needs. In some ways, we were kind of giving some to quite a few things, not all to one thing. It shifted over time, but economic development and we use some of that for critical control. And I felt comfortable making that argument using the ARPA language and the fact that our predator control affects the hunting, the wildlife and hunting and things that Harney County economically benefits from because hunters come here to hunt and various things like that, that have an impact in the county or hotels and everything else. And of course that pertains to the event center, you're talking about stuff like that all the time. So, there's a lot to these conversations that can be made, you think about. We just, the county court will be having that conversation over times.
So my question was, and Rick's not here today, being the chair, we've tentatively approved each department and each fund. Do we have to now go in and do a final resolution or a final motion?
Yeah.
Approving, not adopting, but approving the budget as a whole.
Mhm.
I couldn't remember. And the tax rate part of it, we don't have to do that at this level. We do that at the county court level, right? A resolution, setting the tax
Well,
rate.
let me ask you this, some of the things that were raised in our tentative approvals, such as double checking PERS and various other things that hopefully will not be significant, but nevertheless are gonna be followed up on. Does that in any way make you feel there would have to be one more check-in for our final budget board approval?
No, because the committee has reviewed it, understands the potentials that we need to review. I believe that the committee can approve the budget as presented and as discussed. If there are issues that need to be corrected within PERS, then the county court can make those before adoption.
Okay.
But we've discussed it. I mean, everything's on the table, so it's not anything. And then, I would say though, in our final budget hearing, when we adopt, any changes that are made between now and then, and I did last year, as I recall, I think I brought up any small changes that we made, that those be identified at that hearing. So that everything is again on the record. And
One other idea that plays into that and the concept of potentially having another meeting so that this group can approve a budget to propose to the county court is how we handle the minutes from these meetings, because this is come up in other organizations too, and they kind of forget to go over the minutes, and technically those minutes aren't the county court minutes.
Yeah,
Somebody needs
I was wondering about
to
that,
have
we
them
didn't
be
approve.
involved in the group. Can't do it today because we don't have all the minutes.
Can it be done by email once the minutes are, we all saw that first set of minutes, which several comments were that they were very good, and they were.
Just needed a quick check-in meeting once all these changes have been made and the first stuff is adjusted. Make sure everybody's on board, and at that time, we can take action on those minutes, because I don't think we can take action on them via phone. And
well, again, we don't need to take action from this body. We can take action at the governing body level.
What doesn't the budget board,
Well, that's what I just said. If it's all on the table, we've all discussed it up to this point, any issues that potentially may be with PERS or whatever. And if the budget committee wants to approve at this point, any changes that are made from this point to
we're talking about
adoption.
approving the minutes of the budget committee meetings for the record.
I don't know. It doesn't say that I recall reading in the budget law manual about having a final meeting to approve minutes or anything. I think,
I believe is there some reason you don't think, people can weigh in by email whether they approve a set of minutes?
because it would constitute taking action because you're adopting those minutes, and I think it has to be done in a public meeting.
Can't the county court just approve them?
I guess we could, that's what we were saying, I think.
I was just asking this group because, I mean, they're not technically our minutes, but if the
They're-
group is fine. with
The
that,
minutes of this
Well,
group.
just figured
When Holly sends them out, if you guys would just say, looks good or doesn't, that way then the county court can easily approve them if you've all weighed in to us, those. I think they're fine.
is that your budget law manual? I'm not saying it's right, and I'm not trying to say, well, that's the way it's always been done. But that I know of, there's never been a final meeting to just approve minutes.
I recall some years that if it was meeting two, then at that one, the chair of the budget committee that year would say, are there any motions to approve the minutes from the last meeting? I mean, we did that somewhat in some years.
But they're technically,
This is
I mean,
the-
you're approving that session or that portion of it, but we don't adjourn, so the minutes are all, yeah.
About minutes. This says once the budget hearing has been held, the governing body will make changes to the budget that was approved by the budget committee. The governing body must take all available information into consideration in adopting the budget.
Anything on the conduct of the budget meetings themselves? Where
Did we do,
Does say keep careful minutes of the budget hearing proceedings to document your complaints.
there it is.
Maybe as part of this meeting, we can make it known and put in the minutes that they will be sent out for our review by email. And the chairman of the committee will be delegated the authority to sign or something like that.
I mean,
And that could be part of the minutes.
prior to, prior to the budget crisis year, there was not the type of in-depth discussions across so many departments that that is normal for us now to do. And so if you looked up in some old budget committee meetings, it would say fund so-and-so approved, so-and-so approved. It had no detail, no, we didn't capture discussion because maybe there wasn't much discussion back then. But after that budget crisis, I mean, there was so much important conversation as we grappled with it for the next few years. I mean, the year of budget crisis, the minutes taker said he was not going to take the minutes. I ended up taking the minutes and writing them at home because it was so important to capture these very important things that were raised and discussed. And so, I mean, I just did that on my own because.
I mean, I just say like, I don't recall ever a separate meeting with minutes for. I mean,
No, it was done each.
I'm not saying that that's not a good idea to review it and just see if that's not.
That year we had 40 hours of budget meetings. The budget committee was, gone down
You
to
get the same thing that, same results of having, she sends it out to everybody. We have any comments or corrections, so we send it back through the group and say what,
Because it's really just an administrative review.
Exactly.
It's not a decision making, it's an administrative review.
Right.
At the time of our budget hearing, when we adopt, we can say that they've been reviewed and have been formalized.
That's what I would do. We not wouldn't.
What's the date of the budget hearing?
I don't have it set yet.
Oh,
The total general fund budget is around $80 million. Do we have any idea, or will we have any idea prior to the deal you have to do that LB,
The
whatever,
LB1.
how much the other funds are? Do we know what our total budget is roughly?
Not right now. I haven't added everything up yet.
Well, I don't know when the budget hearing's gonna be, but those of us that can come, and the minutes could be approved at that meeting. I don't see why I mean, you're already gonna have another budget meeting.
Well,
So-
Like we're doing as long as we prove you guys that you're good with it and there's no corrections.
Of no less than 4 other groups that are bound by public meeting law, this question has come up and nobody knows how to do it because they're just they take minutes, but the minutes are an afterthought. They've asked the question before, when do we pass these? Because they're not the board's minutes, it's the budget
Budget board
committee and everyone's. I even asked OSBO, their head guy, said, I don't really know. That's why I just want to bring it up for you. If they're comfortable with emailing and looking over.
So the only thing I would be concerned about changing it up this year is we've advertised these meetings. If we decide to have one last meeting, a 30-minute meeting to approve minutes, which we could in the future, we need to advertise that at the same time.
Well, it sounds like what's suggested of just Holly's already shared the minutes that she has, and if people can look at them, that sounds fine. I just wanted to bring it up to the group. And see what this
I was wondering
Yeah.
about it too
Yeah.
after yesterday, because I thought we would approve the first batch of minutes yesterday. didn't, and so
Yeah, 'cause we
which is
never
good,
checked
because
it.
I hadn't read them all yet.
Well, again, as we are changing this process up, whatever, if that's what you want to see next year, that we will approve minutes from previous sessions as we move along. And then the last session, like today, we would approve on another short, small, brief session. Or if you just want to do them administratively, like we talked about, and then we would take care of it at the budget hearing. Because I don't see any guidance that specifies one way or the other as to how we have to do it, as long as we have minutes that show the content of what took place per public meeting law.
I think it's good that we have the thorough minutes we have and that we put some thought into making sure that
Yeah.
we can see it. That's more than most groups.
They're very good. It's a good job, yeah. It's appreciated. I took board minutes for 30 years. I know what you did. The last day was like, Yahoo, I never have to do this.
This season was way better than last year's.
Yeah.
So regarding the issue of having people here ask questions of with the various departments and everything. So it's uncertain when we look at this, what you already know, what can be looked up in the system. I mean, we don't know what we're gonna need to ask of a department head.
So and my idea was this year, that I got it out to you early enough. And we had enough time in between the first session and the second session to review it, make highlights. What is this? Why is this so much more? And then get those questions to me. If I can answer them, then I'll answer them. Or if it's something, just kind of like the fair thing, right? Why is this such an increase? I could go, and there is a note in there under that line that says just backlogged maintenance is what that said. But if you wanted specifics, what are the specifics? And I can go to the fair manager and say, what are the specific projects and backlog that you need so that I can answer, or the budget committee has asked specifically, what are those backlogs? And then I could get that information and present it to you. Or if it's something more complex that's dealing with operations, there's a big ask or something, whatever, for operations, then that's when we might want, like the health department and RHC. That department is so complex, it might be a good thing each year for that one, and maybe law enforcement, public safety, and maybe
Road
departments, that those three at a minimum be three departments that come in to answer those questions as we do it. But it's still more streamlined than having 30 departments come through.
And even if, I think you mentioned it yesterday, but if we incorporated that into what we did, that you did differently this year, and we had an idea of what the budget was, and those three departments in particular that have a more complicated budget, we could get into the nitty gritty a little bit more, especially in a public meeting where the budget committee was there. That would probably relieve you of that.
And the departments that we don't need to do that, they should be presenting what their department does sometime throughout the year. It doesn't have to be right around budget season. I know that was a practice 10, 15 years ago. That's why I used to like to come sit through county court sometimes, was then I'd hear the weed department, they make their presentation.
Regular updates, whatever.
Which Rick
And-
Paul
and
said
because
that
we
there
don't-
was
We
one.
don't want the other departments to think that the complex ones that we need to hear from, that they're the only ones we care about, or they're the only ones, we have questions about. If there's a few,
Holly has scheduled different departments through
Yeah.
periodically for program updates.
juvenile department, I remember all these ones who come and they talk about what they do, which staff does what, and it's very interesting, and it's worthwhile for the public to be on our YouTube channel amongst a regular county court meeting. You can get a gist of what they do.
So at our final budget hearing, could you have us an updated info from the tax department of how our collections are going with taxes?
And I'd like to hear the answer on the PERS thing, what you guys discovered. I mean, that's been a big issue in the budget.
Well, I'm gonna say, I know a couple of those we definitely need to scrutinize, but I also know for the health department, RHC, as we were looking at numbers here and whatnot. That department, as you can see, the complexity of that budget and the split between labor between here and here and here and here and here. This year, I'll be honest with you, I took their budget as they prepared it to me with the PERS dollars amounts and everything. Those PERS dollars amounts on there were not kept. I can show you the sheet that they submitted to me, and it's $95,000 in health department, whatever it was, whichever department it was of the two. But I entered it the way they submitted it to me, because it's I would say it's another element of Tyler that I don't like, that because part of it is billed here and part of it's billed there, and then it's added up separately between the departments, that just plugging in a person's salary of, just say for round numbers, $100,000, and figuring out what the PERS are for that, and then getting a total number, but a total for the individuals or for the positions, not for this department and this department, because you saw the complexity of when you're splitting it up at 0.2 something here and 0.8 something here, and I don't know, it's something maybe we can work on and do a test budget with next year to help verify the numbers or something. But that department is so complex in the way they divvy up their man hours between programs. I just entered it the way they gave it to me. But I'm also looking at the fact that, honestly, what we just looked at is that their actual true labor is less than what they have in their labor line. Like they've inflated it for some reason. But bottom line, they're still making money. They're still solvent, whether they're inflated or not.
So I was appointed for a 3-year term. Is that correct?
Yes.
So I want one of these as soon as it comes out. That would help me a bunch in getting ready for this, because I reviewed this and compared lots of things. And
Say that again, since Bob's here now.
The audit, you're talking about the audit.
yes, I want a copy of this as soon as it comes out. As long as I'm on the budget committee, I want a copy of the audit.
Did we get
report.
copies for each?
No,
Certain people, I've always requested a copy.
I started asking a couple of years ago, and I'll ask again when it comes out, like, who wants a hard copy, and we'll get those, but I'm not gonna order 10 hard copies. I'll order who
And
wants one.
and
then
have
we
5
two-
left over.
And we have 2 public, yeah.
And I've always been one of the ones who always asked, and Bobby Joe always got a copy.
I don't know what they charge us per copy, but if we have a digital copy, we can probably print it ourselves
it
cheaper.
should be part of the bid.
Oh, yeah, but
So I don't think it matters how many copies. you
Well, it
get.
will matter because they're gonna bid per copy that we're gonna request.
I just order hard copies for who wants them, and then we have 2 public copies in the clerk's office. and
I
library.
remember many years ago, there was, when Sharon Johnson was the administrative assistant, there was a big box behind her desk. And it was just full of hard copies, bound hard copies of the audit. And I remember I would just see it a lot, and eventually I said, what's in that box there? She said, oh, copies of the audit, do you want a copy? I went, oh, okay, but they had a lot, but they weren't.
Yeah,
They
there
have
is,
around.
there is a
There was-
point where
there
it's
was-
excessive,
Yeah.
for sure.
Yes.
So we just like to have.
Yeah.
We need.
I just thought the
I
budget
have a
committee
digital
probably
copy.
should,
Yeah.
but.
So you're,
Not everybody wants. one.
Terry, at the budget hearing, just year-to-date stats on property tax collection, percentage wise, is that what you're?
Yeah, and if the big one, got paid, she thought maybe it was gonna happen.
Yeah, okay.
Thank you.
Thank you.
They haven't paid us.
Maybe look them up, there's sticky notes everywhere.
So hopefully.
In that report, you know, like where we are as our collection, where we are total collections, like we're 75, 85%.
We're in the eighties, aren't we?
Yeah, we're in the eighties already, but
But we're normally,
We're in the
we're,
nineties usually.
yeah, that's where I'd like to know where, you know. And I don't know if that one is creating that percentage to be so outrageously.
It is. So one thing on that too, and I'll specify it or identify it, whatever. But there's 3 years worth of delinquency there. And the account could come in and pay. The account could come in and pay the first year, 1 year that's delinquent, right? And then they're only 2 years delinquent. So the current tax year could still be low in collections. But we received 1 year's worth of back collection, if that just scenario was.
That's.
So. Yeah,
So a person could legally continually be 2 years.
and there are some accounts out there that do that.
It's just.
I mean, it's all public record. All you gotta go is look. And
Yeah.
You can see them pretty fast. It's gonna be amazing. People don't pay their property taxes. It's like, wow.
So, I will make a motion. Any other discussion? I
Is
will
there
make a
way for
motion
me to give
to
copy of that
approve
one or no?
the,
You don't have any extra?
to approve all funds presented in the fiscal year 25-26 Harney County budget as presented and discussed.
A second.
A motion has been made and seconded to approve all funds within the Harney County fiscal year 2025-2026 budget as presented and discussed. Any further discussion? All in favor signify by saying aye. Aye. And opposed? And hearing none, we have an approved budget.
Yay! We got them by noon,
I
11:59.
I am extremely serious about, I mean, I want this process to be as smooth as possible. I want it to be as efficient as possible. I don't want any unanswered questions or anyone feeling like they're not represented in this process, being county staff or whatever. And I think, you know, next year, one of our hindrances in putting together a proposed budget is our healthcare costs. And we don't know that until the end of February, an estimated, you know, I mean, it's usually pretty close to what they estimate, but what it is. So when I go to the department heads, I would prefer to give them what their personnel costs are going to be before they give me their operating costs. But we haven't been able to do that. So I think next year, and keeping in mind that the CAPA grant has to be done by the end of April, that I think I'm going to push this process back a couple weeks, wherein we won't have the first budget committee meeting until about maybe the second week of April. And I'm going to have to push back, and it'll be a little bit busy, but I'm going to have to push back when I go out to the department heads for their proposed budgets until we have something to give them. It gives them a better package too. They know what their health or what their labor costs are going to be. So I think I'm going to push that part of it back next year a little bit, which is going to run some of it together, and it'll be busy on our end. But I want to try and get proposed budgets to the department heads that reflect what the COLA is going to be. It'll identify, you know, and then they can come in and say, okay, this is the COLA. I see that this is the COLA. We want to give this person a step increase or whatever. Another thing that I've been toying with for the last, 2 years is how to come up with some way to do merit performance increases, step increases. I would love for the county to be able to afford that when you come to work for Harney County, you get a step increase every year until you're stepped out. We can't afford that. Just can't afford it. And then I've thought about, okay, well, how about step 1, 2, and 3 you get every year, and then step 4, 5, and 6, or 4 and 5 is 2 years in between, and 6 and 7 is 3 years in between. So it would take 3, 7, like 10 years, and you'd be stepped out at step 7. You know, over a graduated period like that. I'm not too sure we could afford that either, to be honest, with our revenues the way they are. So the last idea that I've come up with, and we can discuss this more next year when we go to that governing body meeting or before that. But the next idea I've come up with is, so like say next year I propose a 2% cost of living increase and we figure that, do the runs and figure out how much that's going to cost us. And we have this much money left over. This much money left over would equate to say 10 step increases, just round numbers. We have enough money left to facilitate 10 step increases across the county. Well, or at least maybe by fund, because road department's going to be different than general fund and whatnot. So we determine within general fund, we have room for 10 step increases. Road department, we have enough for 4 step increases, whatever. But then we come up with kind of a rating criteria of how long the individual's been with the county, when their last step increase was. Did they, have a favorable performance evaluation? And maybe 1 or 2 other criteria as we brainstorm it and think about it. And that comes before the governing body at that pre-meeting. And we rank and decide, okay, well, there's been 20 proposals for step increases, but we can only afford 10. The top 10 scoring people end up with step increases. Something, we got to come up with some kind of a mechanism.
Well, I just know that the feelings of inequity amongst county employees comes when they feel like, well, this is how it worked, and now everything's changed because you're saying that the budget and the revenues are down, and now this and that, and they turn into semi-grievances. So we need to be careful.
Well,
I know,
I can't fix the inequities of what happened 5 years
I
ago,
understand that,
whatever.
Bill, I do. I'm just saying, more to come. Thank you for throwing it out for us to think about, but
And we
I
can't
want
continue on the
everything,
practices the way they're.
percent CIS or whoever says this is totally okay process, no problem, no, they can kind of ensure that if we follow whatever process we propose, that it cannot be grievance. Grievances can't apply if we are doing it that way, because
One thing I think.
And-
when you get that study done, where people fall into the grades, whatever you call it, whatever you're gonna call them. That will help tremendous.
I hope so, yeah.
Well, I think that it might take care of some of the inequities. If you've got somebody that's kind of slipped through the crack and they end up over here, but they've been getting paid down here, I would hope that that's where that.
So
study is
let me
gonna
give you
help change.
some generic examples of current situations in Harney County. And quite frankly, I'm going to call it out for what it is. It's favoritism, good old boy network is the way it's been done in the past. And there are people in this county that work for the county that have been in the county with the county for say 15 years, and they're not stepped out. There are people that have been in the county, been employment of the county for 8 years, and they're 1 step away or maybe are already stepped out. I'm not going to continue that way. Unless the governing body orders me to do so, I'm not going to continue that way because it's not fair.
I really work in the banking world, really, main thing. And every company that I've worked for has always had a merit system based on your performance. That eliminates that good old boy, I think you all deserve this and that, blah, blah, blah. You didn't. There were times where you didn't get anything. You were performing the job level, that was it.
So let me give you another scenario that happens annually. Is we do have performance evaluations that are rated from 1 to 4. And we have tried to provide education and training to the department heads and supervisors that say a 3 and a 4 is above. A 2 is satisfactory, but a 3 and a 4 is above satisfactory. And we get performance evaluations back that are solid 3s and solid 4s with no justification.
Some are solid 4s. I have one department head is on it. They do wonderful evaluations. And if it comes down and somebody's looking at an evaluation, those employees have good evaluations.
So I have thought about taking our performance evaluations to just a satisfactory and an unsatisfactory.
What the
Because the
government
scoring,
did.
because the scoring mechanism does not work.
No.
And I know just having to do an evaluation for someone. It's so lengthy and in depth, people get lost in it.
Yeah.
I feel like it needs to be simple.
So I agree though, totally. If a person is not performing, they shouldn't get a step increase, period. So,
If you wanna do just the job,
yeah,
get just the pay. But how do you differentiate between everybody's satisfactory, now they're gonna get a pay increase?
so the policy only specifies that we have, and this is the only policy we have written down, is that a person has to have a satisfactory performance evaluation, which means if the supervisors were doing things properly, a person could get a performance or a step increase just with twos. Because that's satisfactory. A two is out of a scale of 1 to 4, a 2 is satisfactory. So that's all you need.
So I'm
That's all you
thinking
need.
that all of this is good, this makes sense, and haven't any other counties already got this in place where we can see how they've got it laid out policy wise?
There might be, should, or I mean,
That would help us a lot. Let's not start from scratch unless we have to.
well, yeah. We can get ideas from other counties on their policies. But we would probably still need to tweak it for our own situation.
So I have a question. Rick told me last night that there was a county court meeting where the road department and one other department, the weed department, came in and made presentations on stuff. Is that correct? You
I
remember?
know weed department did, they always do an annual, they get scheduled to present to the county court.
Yeah.
Which is what I wish every department would do.
I think he has a requirement to do it based on
He does a great
on
presentation.
some
Very-
element of his
very
program. But that's what we were talking about throughout the year, periodically throughout the year. We'll have the sheriff's office, juvenile department, justice of the peace, whatever. There are some, the fair is supposed to present an annual report by statute. So there are some by statute that they have to, and others it's just, hey, nice to hear what's going on and where your program's at.
And it's nice not to have them all in 1 or 2 meetings, you know, that's why I say spread out. I mean, you know, what works for them too, but it helps us make a county court meeting kind of have a little variety to it.
Well, can I get the road department's other project?
I don't remember him
list?
presenting.
They can-
I mean, but
I
you
don't-
said he has one.
Has-
Has some other budget project list other than what this budget reflects. You said that there's another one. Can I get that? Then maybe it'll answer any questions I have.
I'm not gonna bet on it.
Huh?
Just kidding.
What did you say?
I'm not gonna bet on it.
Oh,
No, it's good to ask questions too.
Okay, so I will, well, if you all want to copy this, I'll give it to you. It's got a lot of notes written on it. But basically what you can, what's that?
We're fine.
Basically what you'll see is the approved budget column where he hand wrote things in. And then over in the adopted column, because he just used it to delineate between the two, where he would make cuts. So like just right off the top, diesel, he's budgeted $300,000. If the SRS funding doesn't come through, then he only projects to spend $200,000. You know, parts, freight included, 175,000 budgeted. If it doesn't come through, 150,000. So he's you know, another line here is 150,000. If the funding comes through, it's cut down to 50,000. So he's had separate lines here. One of them's 200,000 to 100,000. He went through and looked at certain lines and said, if we don't get this full funding, I'm only going to spend this amount instead of that amount.
So part of what stems from this is comments that I hear in the community that the budget board just rubber stamps everything.
Not true.
Hasn't been
Well,
for many years.
But I'm saying that that's the perception.
They should come to the meetings.
Yeah, watch the videos.
But I felt like with the road department, for me, it was a rubber stamp. Because I didn't have the questions answered that I wanted answered. So I want to get those answered.
Was in the past, he had presented, not like that, he had presented.
We used to have all the
things that-
departments.
We used to have
come for
all
all
the
of them.
Yes.
Well, on the road, department, he'd say, I'm gonna do this section and this road and this bridge.
Yeah.
and Blah, blah, blah. So we knew where it was
work was-
going. And that was the one thing that we didn't have this time, but.
So we did,
we could-
the first meeting was 9 to 4, basically, and I think in years past, we've done what, 4 to 6 hours a
Yeah,
meeting?
like 9 to 12 or something. We do a lot of 9 to 12,
Yeah,
but
we
we have
9 to
like
2 or
10
something
meetings.
like that.
Plus,
So even if you cut these in half this year, we've done 5 meetings worth, because we're at noon right now. So there's 5 meetings compared to what we've done in years past by compiling them into the 3 days, 2.5 days.
Which I like.
If we want to go back to having every department come through and present,
I don't think it's necessary.
that's what
No,
she-
I don't think it's necessary.
And you know, the way you did it, I think is absolutely great, like, but if we could, like, the road department and maybe.
Public health
The ones that
RHC.
we have questions of, is have one look to you guys, one short presentation of what they,
And it's
Built
recorded in case you're not
And
there
then-
watching.
then when you come, well, you would have that back then. It's like, why do they have this or why do they have that? When we question it.
Just the ones that are of
Yeah.
particular complexity or
Right,
concern for the,
so when they
Budget
present it to
committee.
you, they've got something in writing that.
Or why
But
can't
it-
we have them jump on Zoom? Call up
Yeah,
Kelly and say, hey, can you jump on the
Yeah,
Zoom?
there's plenty of capability for that.
Yeah.
Yeah, they don't even have to come here.
Yeah.
so that's, but takes a little bit of pre-planning.
Yeah.
It takes a little bit of pre-planning in review for what we're gonna cover the next day. That if the committee has questions about a certain fund, I'd like to have the public health person here or the road department, unless we make those standing appearances, when, that's fine, but otherwise, I need to let a department head know that, hey, tomorrow we're gonna call upon you to.
Sure.
and Deb, you attended a lot of the budget committee meetings last year,
Last
right?
year.
And like, for instance, Doug Fur has also done some this year and some last year, and then there were additional people that watched some of them last year. And so I understand, you cannot control what people say out in the community,
Exactly.
okay? Because I mean, that's
Yeah.
never gonna be conquered. You always
Right.
take the time to explain, but I've never had anybody who sat through a couple of sessions who didn't go away feeling like it's very thorough,
Yeah.
you know?
Last
it's
year's
a very thorough
attendees
process.
there were quite a few people that attended most of it last year. And all those people that I heard from afterwards is like, I never had any idea
Yeah.
what all gets put into
I
it.
mean,
I know.
I know, I don't get upset when I hear that that's the perception, but in fact, I just feel fine, like, I know that's not true, so, it's okay. People are gonna say. what
Well,
they
I just don't
say.
know how you get people to be involved. It's like, they just wanna sit on the outside and gripe, but yet, have you ever went to a meeting? Do you know what's going on? Have you asked questions? No, they just make.
Well, and you guys having been through it, several years, you probably have less questions
Right.
than I do, but, but I also,
You have the.
But you-
I have a different knowledge level
Yes.
too, and so,
And you bring up a lot of questions that make me go, oh, I didn't think about
You-
that. You bring up
Between
great-
everybody, a lot of things get raised, it's good.
Yeah. We don't think about it.
I will say that this process, it's vague in the manual. Says that the budget committee can review and make changes. Only changes are gonna be by vote, obviously, and we kind of had a couple of those last year where I ran it that way, and I'm like, this is my proposed budget. If you want changes, you're gonna have to not tentatively approve it, and then which sends me back to the drawing board as the budget officer to have to recalculate or refigure that budget. But it says to review and make change, agreed upon changes, whatever. It doesn't, the purpose of this committee is not to delve into policy and operations, really. It's to scrutinize how the money's being spent, but it doesn't have the authority to affect policy or overall planning.
They can ask, the budget committee can ask for.
Yes.
Any documentation.
Yes.
Right, that's the way I
Yes, it
understood.
does. It does specify that the budget committee can ask just about any questions they want. I just, and I don't mean to take away from anything there. It's just I'm trying to keep everybody in our lane as to.
Well, I really liked how the county court had that meeting with those particular departments who felt, after having done the negotiation and work, still felt that they had an ask to make, and they insisted on doing it, and they did it, and it was in public session, and it was, and we had to vote, and it just took a lot of the angst and continuing requests that go on and on and on, even during budget season, until they get an answer. Then they accept the answer, and we try to give a good answer. What's different about our county in this phase that we're in is so many other counties aren't in a deficit, aren't right to the bone, aren't having to let people go, they're not in that cycle. We are in that tough place. And so their budget committee basically is looking at a healthy budget that's paying for the services, the employees, the reserve, and some initiatives and investments that the governing body has decided to do. And they don't usually have a lot to change. They're just making sure it all adds up and they're not in the hole, and they feel like integrity has been done. Here, I mean, this whole community pulled together when the budget crisis happened. It was, many people involved, very alarming, a big breath we had to take and figure it out. And you guys were on the budget board back then. These guys had to roll up their sleeves. We did 40 hours and it was open to the public, and sometimes it was on, live streamed. I don't know. We had different technology at the time, and it was as open as we could do under difficult circumstances. But our county, people get involved when they hear rumors, particularly. But I just feel like we're as open as we can be, even on making very difficult decisions.
Well, it's, I wish that I felt like I had the time to listen to every county court meeting, because there is a lot of information that I feel like I need, but what, I'm not your normal retired person, and I'm working full time volunteering.
On
I
Sunday,
swear.
on
40
Sunday
hours a week
evening,
at
you
least.
don't pop a bowl of popcorn and sit down and watch the most recent
You'll fall
county court
asleep, I
session?
guarantee you. It makes you drowsy, some of it.
Well, and when Holly and I, when that whole budget crisis, we come up here on our own, hours and dug through audits and everything, and when people say they stole the money, I'm like, they did not steal the money, they spent the money, but nobody.
These two, because they weren't a quorum, they would be in that break room and they had stuff out and they dug into it independently as citizens. Members of the budget board who want to make sure that what the county was telling them happened to that $2.3 million is what really happened. It was,
Yeah, they did spend it, all right. Getting in the.
and I appreciate that you all did that, because.
Well, it's just like.
But we did locate too that there was, there again, Tyler, system was not taking the Indian fund balance and moving it. It was a new number that had nothing to do with where it ended up the year before. It was not moving properly. And it wasn't doing it on every department either. That's what was so scary.
It automatically,
Yeah,
it's just like,
and then you look at it, you go, well, this says it should be 200,000.
but then there's.
So it was
60,000,
moving
you know,
back.
it's like,
There's-
oh,
I was looking here and here, it's the same number.
It was moving the projected. It was moving the projected forward instead of the actual. forward.
Yes,
Yes.
yeah, but it made it.
And they just kept
Confusing.
compounding every year.
Well, I thought,
5 years.
I thought they just started out every year with the same beginning.
It was taking.
It was moving the projected
Yeah.
forward instead of the actual.
Yeah.
Yeah.
Okay.
And it was just like, what? Couldn't connect it at first.
It took us a lot of days to figure out what happened.
So, but we did.
Well,
Thank you.
This was, there's a lot to go through here and, you know, last night I was still going through this budget. So it would be hard for me to type up a list of questions 2 weeks in advance of yesterday because I just, that's on me. I get that, you know, my time management and everything, but, and what is prioritized for my day on any given day, but you know, my day changes every day when I get up in the morning, so.
It just might be as simple as, you know, you can't get past that home health hospice, see if Matt can jump on a Zoom. It might be just as easy as that
Or,
to answer the,
you know,
answer questions that are happening right now.
yeah, or significant changes, you know, maybe just a summary from the department of why that is or something, you know, that we can review or,
And
I don't know.
you know how this time on the first meeting, we did the non-employee kind of departments. I kind of like that, but maybe that would be the last day and any of the questions that are generated from the earlier meeting or two.
Yeah, well, but
That is built in for
Yeah.
those department heads to be accessible by phone or Zoom.
2 weeks later,
I don't know. I
yeah,
mean, depends on how.
Yeah.
So much is.
And in the future, if you build on some of the changes we made this year and really focus on getting those questions ahead of time. So that is the focus and not have to focus on going through fund by fund.
Yeah.
Because to me, that's counterproductive and it can be more efficient. If we go through the questions people have, if we all sit there and look at one page for long, we're gonna have questions that come up. They aren't
Absolutely.
necessarily,
That's a good
I
point.
mean, they're not
That's good.
invalid questions, but
Right.
they're not necessary questions, with the exception of the PERS. Who knows what's going on with those numbers, but aside from that, a lot of those ones have passed. It's not even worth the 30 seconds or 2 minutes, it turns into 5 minutes.
Yeah.
When people have questions about stuff, then we can get into that nitty gritty in the future. I wish.
I could become.
I didn't take your direction as direct as I should have to email the questions ahead of time and have them. But I think if there's a paradigm shift, and we don't have to go through page by page and look at it. If everyone does due diligence like we do, it's gone through it, has their questions.
well, it's gonna be more work for you also if we send in a whole bunch of questions than if we just, especially if you can just
And
answer.
that's a given. I mean, I'm up for that. I'd rather have that information and be able to answer those questions so that when they're asked, it's there. The answer is there. And for our live session or, you know, our recorded sessions and whatnot, it's there instead of having to research it and come back with it at a later time. I don't mind. I don't mind. That's just all part of the build up to this process. But I do want this process to be our process. I'm coming up with ideas to try and do things differently this year, and it'll evolve next year into whatever, but I want it to be our process as a committee, not
Well, and I don't want it to be so simple that it's not transparent either.
absolutely.
You
Yep.
know, I mean, that's the
Yep.
whole purpose of it too.
Yeah.
So,
And one of the things about the page by page, when you do have new members of the budget committee, which you will regularly have,
yep,
is that's the best way to get them oriented to what they're
What's
looking
that?
at.
yeah.
I said when the old ones die out.
Who's on there last year this year? You are?
You know, I mean, you guys both, this is your first year and yeah, we went page by page, but we don't have to do that, you know. Well, is anyone going off it? This
This is
la-
my last year.
this is your last year? Oh, okay, so there'll be, a new
Because I think
person
so,
next year.
also we rotate off.
Right,
We did
okay.
this last year.
Well, I don't know. That was just a thought. The page by page helps when it's your first year because now you've heard the comments. Or,
But maybe like Rob said, not ask questions for just asking questions sake. You know, unless it's something that you're really, really, really needing an answer for.
Well, and I think we try to appoint good members and we have good members on this committee, but there is the potential that if we're gonna go through it page by page, people don't feel the need to read it ahead of time. I know, no, I did, no, you did, I'm sure we all did. And so if you've already done that, there's no need to go through it all again if you have those questions. And I think we could keep a new person up to speed as well. We could slow it down if we were the team. The new person had more questions, hopefully they would, but people are less likely to do their homework if they know it's gonna be open book in class.
I try to do my homework as much as I can to answer
Me
those
too.
questions ahead of time. But as you saw, there's a lot of digits, there's a lot of lines, there's a lot of information there that it's hard to know everything.
Was thinking, we were talking about what you had said about the merit or however you want to call it, steps. The way it has been since I've been around here at Budget Board is always a cost of living. And I liked how you said have a cost of living and then have this extra money to make those adjustments that need to be to bring that person up to a level that should be. Because when everybody gets the same thing, and I've been working my tail off, I don't feel rewarded. But if you lowered that and everybody got the cost of living increase, and I've been working my tail off and you give me a merit increase or whatever you want to call it. I think I recognize the fact that you saw they've been working really hard for you.
So with the federal government, some of you know, step increases are pretty much automatic. 3 years, you get a step increase. 3 years, you get a step increase.
but they have all our tax money.
Yeah.
So,
The assumption is they get better at their job experience.
Yes.
Not some of them.
Grade
No.
step 1 through 5 is automatic every year. Step 5 through 7 is every 2 years. And then 8, 9, and 10 are 3 years in between. And that's where I'd come up with that graduated idea.
And I just liked when you said that, and I didn't make that comment, but I did want you to know that I like it saying lower the overall cost if we have.
I think one of the biggest issues is people come into a job at the pay that the very experienced person got when they left. That, I think, is a very big issue. And if we took the beginners down to where beginners should be, there's a lot more play in the budget for giving raises to people that have been here a long time.
So this year, my motivation this year for just doing a COLA was with the past year, the inflation that we've experienced in the past year. My goal was to try and give everybody as much as I could. So a 3% across the board, which really that's all I gave last year, plus a few step increases. So they didn't really get any more. But again, as you've seen, our revenues are not where they should be either.
Now, if your revenues aren't going at 3%, you know, of the value of your expenditures, then you're doomed, even at
You know,
that.
the future of SRS, secure rural schools, you know, you've got to really work and hope for the best on that, because that's.
Everything's on the line.
That's where the economic development comes in that we were talking about earlier, you know?
I'm optimistic that the SRS and the last of the SRS will force them to re-examine how they compensate counties for public lands. And I know there's some strong leadership, hopefully is gonna be involved with Western states. And they're already hearing it, they're already talking about Washington, that we can't afford to bankroll your recreation grounds. So hopefully, because if that goes away, a lot of people are gonna be squat.
I did the same kind of analysis when I worked for that agency on what a county would get for PILT versus what a county would charge for property taxes with the agricultural farm deferrals and all that kind of stuff. And the PILT comes in way less than what a state would charge,
Sure.
you know, on
For
property taxes. But at the same time, the amount that the permittees are paying to graze those lands is extremely less than what a state or a private individual would charge in grazing permits as well.
Well, if we get $1.4 million in built, our public lands don't generate $1.4 million. There's only 800,000 BLM acres in the whole state, having $1.35 an acre.
Yeah.
So there needs to be some re-examining all around. People gotta pay to play a little bit.
Yeah.
Yep. Yeah, $1.35 a cow-calf pair is pretty cheap.
One thing that I do miss though is like when the department heads used to come and they used to come like with an update. I just remember like juvenile coming and saying how many people they served or, you know, just a little update,
That's kind
a
of.
recap, you know, and maybe if they could just put it in a writing, a little summary, and then it could be passed out to us. Cause I do miss, I mean, I remember some of them coming in and saying stuff and it's like, well, I didn't know that happened or this happened. And I like to hear in the juvenile stats, you don't know how many people are involved in that.
But it's like,
This
like,
looks
like,
good,
And
yeah.
part of the reason I want that to be throughout the year is for just any of the public can. And those YouTube, have you ever viewed the YouTube county court meeting?
Yeah.
Oh, okay, yeah, you know, I mean, you can just scroll to where you see their talk and then. listen to that
Like,
part. I
like
don't
when
Want to hear about
yeah.
this.
What had happened during.
But you're right, I mean, the value, it's good for them to tell us, all of us, the public, what they do, what's been happening this particular year, what's coming, and for us to thank them, you know, and they each deserve to have that, and there's just not enough time to do that throughout
No.
what we're trying to
But
be
I
a
don't
more
want to go
efficient
back to
budget.
this other point.
No, I think if they could just, because they would write a summary.
I missed that a lot,
Pass it out
I
to us.
pushed for that since I've been on the county court, and I was in the minority on that.
So a written program,
Even in committees like NRAC, I would even like to, and you know, I just think the committees library, they should get scheduled. And that's their opportunity to inform the court and i.e. the public,
What they're
you know, this is what we do. These were our challenges. This is what we're working on. We'd like your help if possible. And we can say, well, we'll meet with you or thank you very much. You've done a great deal on these things, you know.
Just like when you said about fair, not getting all the lottery dollars, that they're working on it, getting those lottery dollars. I have no idea if you weren't getting the whole amounts.
Oh, for years, for many,
I mean,
many years.
I have no idea.
30 years. Yeah.
I mean, it's,
Because you don't hear that unless.
unless you're involved in
Yeah,
legislative.
I mean, I knew we had that 1%.
It's,
But-
it's good for those department heads to have to prepare to present as well, because then they have to ask themselves and kind of evaluate, what am I accomplishing? What are my goals?
Yeah,
Not that they aren't doing it, but it's good to
it
readdress.
is. It is.
What are we
It
getting
is.
done?
Especially
What do we
people-
have to show?
And the connection with, in our case, the county court, just you're looking at each other, you're listening to them, you're thanking them, and that just doesn't, I mean, if you have all day to go to all the departments all the time, but you know, it's, they deserve to do that, and we would love to see them in action. And that's, you know, it doesn't take that long. They don't have to have a visual presentation. It can just be verbal. If they, in the case of, you know, we department, they do a PowerPoint and everything, and they may have other requirements to present a certain way, but you know, I think it's been many years now where that hasn't been a regular part of county court, and I think that when the newspaper covered the county court,
Well,
they
that's
used to
what
have a reporter.
I was
every-
gonna say, yeah.
You would, that some of that was captured in the newspaper, but since that's not happening, at least there's a place people can
do
listen.
you want a copy of the departments?
I do.
Do we have 12 departments? That was somebody told me one time, is that, how many departments do we have?
So within general fund, we have 1, 2, 3, 4, 5, 6, 7, 8, 9. 9, 10, 11, 12, 13, 14, 15. So there's 15 in general fund. And I didn't count the jail and the sheriff's office separately. They're more or less one department. So there's 15 in general fund. And then outside of general fund is 1. I mean, then do you want to count each disposal as
Thank you.
a department or lump them all together or?
They probably don't need to come and talk about pushing the trash.
Okay,
I was just wondering if it's even reasonable, if that's putting too much on the department heads, or if that's reasonable to ask to have one a month come present, or one every other meeting. I
Well,
guess that's same as one.
they could do a written report. People could provide written reports.
Holly, in the past, when you've reached out to schedule departments, how does that go?
It's like pulling teeth out of someone's head.
They don't want to do it,
No,
or?
not at all.
No.
Because they wouldn't have to write it up if they didn't want to. They don't have to do a PowerPoint, but if they'd rather just say, here's a one pager of what we accomplished. It could be however they want to showcase their department, it sure would be helpful to.
I think it would be good,
Because like when Dad. had
So
come
there's
that one
8
time and said,
8 other fund departments outside. So that would be what, 23?
"How's this legislation that might happen?"
Yeah.
You know, that's gonna be twist up everything.
If you guys wanted to submit like your preference for the employees to present, like
That's exactly what I
I
would
can work
like,
on those
you
first.
know.
Yeah,
highlight
that's-
that in
yep.
things so that I can.
Any of them, all of them, as they can, but like we used to get veteran service officer would give us a report every week.
Yeah, he's been here. He was here last year.
Not
I had
memorable, I
a
guess.
sheet and I don't know where I put it.
Don't remember much.
Okay, Bill's brought up, which I thought was a good idea in terms of doing a meeting that did an overall of the water issues that were going on. I think it's more appropriate than ever before now. But also,
It's on my to-do list. It's on my to-do list.
but there's also, it used to do a state of the county meeting in February.
Yes.
And
Oh,
Did they?
wherever, that was ever on your agenda. But, when you talk about getting the word out to the citizenry, there used to be a lot of people that would attend that
Yeah.
and get a catch up. But it's also something where you could do an overview of the county, the state of the county, but also if you wanted to have, you know, your own ideas of which departments might give a good presentation or something, like the weed department. There's programs out there I wanted to promote on Medusa and when you can apply, because when I found out about the programs, it was already too late to apply. You know, anyway, so just a thought, something you could do after the first of the fiscal year. You know,
So yeah, the chamber did those state of the
Yeah.
county, whatever thing. And they did it the first year. I went to the first year, 23, when I was in office, and then last year they didn't do it. Or this year they didn't do it. So it was last year I went the first time, I think.
anyway, just something to think
You know, I
about.
mean, the county court as a body could put together a report once a year with, you know, the state of the county, and we read it during county court. Do our own state of the county.
Specific thing,
If
you
it's-
know, what you're telling me is you haven't been reading the paper. You didn't, yes, I did announce, I did put in there about legislation that increase the fair, income and things I've
Oh,
addressed.
no, I
different-
was talking about another one, this is.
Oh, well, I have addressed different legislation.
But I have heard a lot of people tell me they don't take or read the paper anymore.
There's a lot of people that do not read.
But
I mean, I do.
at any rate,
Cover to cover.
I do.
There's
People like, how do
specific
you know that? I
issues.
read the paper.
yeah, exactly.
If there's specific issues that the county court wants to address, because, you know, I come to a lot of the meetings and I try to, you know, but I don't feel like reporting on every meeting if there isn't something that I really consider a highlight when there's other things going on.
Right.
So if there's something you specifically want, you know, just
Trust me, because I'm usually here.
No, there has been one of the good things about having that YouTube channel, in my opinion, is that some of the people that used to call me with questions on a somewhat regular basis, all of that's answered in there in better than I can do if it wasn't my topic, and even if they didn't do a lot of computer, they knew how to click on a link and watch something, and so I'd show them how to access that town cloud, and the YouTube channel. And they told me, thank you. I feel like I'm up on stuff now. Of course, like you say, I watch a 3 hour.
I really appreciate the research that has been done on the status of how some of these funds were started and what the resolution actually says.
I
We did-
appreciate the notes that you put in there.
We
this
did
year.
most of that last year. There's still a few of those funds we can't find the resolutions for. We continue to search for them. There's a place in the.
So those significant resolutions, are they online? So a person. can
They're in
read
the
them?
they're in the archives. They're not, I don't think they're specifically online.
Would they ask the clerk or
Public records request.
Yeah.
public records request?
So in Tyler,
Wouldn't see that. You're supposed to be very good. Which. Seems to, that's like.
You did?
Oh, yeah. We didn't.
so in Tyler, each line, there's revenue lines and expenditure lines. Each line has the potential, like say this first one right here,
Oh, yeah.
to put notes in. And you can make permanent notes, you can make current year notes, or you can make next year notes. So during our process, and where I put those resolutions in there are in permanent notes. So it'll always be in for that fund or whatever. Current year notes, as I'm doing, and I will say this year just was so hectic because of the personnel side of it was hectic that
Yeah.
I didn't get as many notes in this year as I would prefer to have had. But current year notes, as we're doing, as I'm preparing the proposed budget, I asked the department heads, so if you have a major increase in a line or a decrease or whatever, what's that for? So I can put that in there, and then I know you guys are gonna have questions about it. So that would go under current year notes. And then next year's notes, if say we were going through and scrutinizing the budget and they're like, we'll see what this looks like next year or whatever. I could put in a next year's note so that it would print in next year's budget and it would remind us to look at that. Just to show you capabilities of what Tyler can do, in this process.
So what was the oldest resolution that you uncovered for the starting of the fund? How far back?
I don't recall.
The records drop off pretty severely around 2017.
Oh, really?
The archived documents dwindle away pretty much. Before that, it's pretty good documentation.
You're laughing at the year you quoted. Cited.
Just laughing at that year, nothing else. The year.
We know the significance.
We know the
of it.
significance.
So, just for the use of that function, which even in, having those notes, it's there for posterity. You print the final adopted budget and it has those notes in it, and that gets saved for archives. So even posterity, it goes back and you can look at the notes. So I think the note function is a really good tool. So I want to thank everybody this year for your participation and service to the county and the budget process.
Can I ask one, Well, question, but for me, the no voter. It was mentioned that there was something in works with my, comments about the, director position at the senior center. And you mentioned there's something kind of in work. Is that something that's gonna get accomplished in this year time, or excuse me, this budget cycle? Not this budget, cycle, the next budget cycle, excuse me.
I don't know. It's, I don't know.
Probably
It
not.
could be a couple budget cycles before we get to it, before it takes place. It's a decision that the county court, the governing body, needs to make on how to move forward with it. I mean, I pushed it forward this last year, and you were present for the meetings and the discussions. I will say that the senior center, the hub director, doesn't have to be a county employee. I find it somewhat hard to navigate to have an employee, a county employee that manages a nonprofit that we as the county court, it's not a county department. It's not under our purview. So how do we as a county court, and I as a county administrator, how do I supervise somebody that's doing or performing a job that we we don't have any say so in their budget. So it's a little cumbersome there. By statute or regulation, our transportation function has to be a county employee that monitors and manages those grants, the stiff grants and whatnot that come from ODOT. But that doesn't mean it has to be the director to do that role.
So I can see changes maybe being made if there's a change of personnel.
Or I'm thinking of structure.
Manager, she's the program manager. But I think most of us maybe, I think most of us understand where you're going.
Well, I understand, but I'm just trying to see if there's a solution in my mind of how to, what would it take to change how, if we're only required to have the transportation and the grant portion reviewed by an employee, what would it take to move that position out of the county? I'm talking just position.
I know.
I'm only talking to position.
Just an agreement. You know, we don't have
Would that be an
a
agreement with the,
I think that's so odd that,
yeah,
you can contract out your mental health,
Yeah.
your public health, all kinds of things. There doesn't have to be a county employee amongst their organization in order for these funds to be properly managed via contract. What's different about those transportation dollars that are used for those purposes than any other contracted thing?
just something somebody stuck in
yeah,
a statute somewhere.
It's just odd.
It's an element that needs further review,
yeah.
you know, and at this time it wasn't real high on the list. But when we move towards a solution for that, or a solution, a decision for that issue, I will want to know that statute, that regulation inside and out as to what it exactly says. And what I was told by the person who coordinates those grants on the ODOT side, that it has to be a county employee. But I have
again-
also been told by that same person that there are a couple of counties who have navigated around that somehow too. And again, I don't know the
It
extent
doesn't
of that.
actually have to be, the position of the director.
It could be like, say,
Right.
the head bookkeeper or something
Yeah.
like that, to become a county
And
employee.
This would be my recommendation to the court because it's going to be a court decision. But if those funds have to be managed by a county employee, then we would create a job description for a transportation coordinator or whatever those duties would require. And we would have that position analyzed and fit into a grade where it's appropriate. Then the next step then is to determine how many hours is required. Is it a 0.5 FTE? Is it a 0.25 FTE to perform those duties? And then that's how much money we would pay towards that position. The rest of our contribution from the county will be a lump sum contribution outside of that salary.
That's what I would hope. That, I mean, we've moved people out of the general fund and we've departments out of the general fund. We've done all of these things to make it more visible to everybody else, make everybody know what's going on. And this is one area I don't think the public really knows how that was structured. And until it got, out there of people saying that seems like an awfully lot, that's on the director's side, because I don't think the actual public knows or had known about the structure.
For the record, because anybody who's watching this,
Yeah, they can.
that's watching this to the end, it is not my intent, and I think the commissioners would say it's not my intent to cut off support to the hub. It's a valuable program in our community that I think needs to continue to happen and be supported by the county. What I'm talking about is the realignment of the county employed position that has to manage those grants. The hub, the director of the hub should be a hub employee and should be compensated by the hub.
That's exactly where.
So I'm not
Because
talking
the
about-
decisions, the board evaluate, I mean, it's not a county.
Yeah.
So I'm not talking about pulling support for the hub, and I'm not talking about deleting the director's position. Now, it would be deleted as a county employee, but the position would still be there and be funded and paid for by the hub. Because that was part of the misinformation that went around last time, is that we wanted to delete the director.
County based on our ability, revenues, would be able to then to give back to the hub. And that amount might change, just based on what we have, right?
Based
Ups and
on-
downs.
Based
Be
on
able to
financial
navigate.
ability.
Our financial ability
Exactly.
versus an employee position. Doesn't have.
Well, it makes more sense for their own, the director is not really reporting to or beholding to the county in the way the other department heads are. And they're a nonprofit, they shouldn't have to, but the way we have it right now, it's convoluted and expensive.
Is there a requirement that, directors or department heads, report if they have other outside employment?
Yes, it is a county handbook, employee handbook policy to approve, and
We need to have a work session with the hub's board to try to identify how we can maintain the same, if not better, services to our senior community and still support the hub and not have an employee that doesn't really answer to us. Would that be appropriate to?
Yeah.
Work session with
Yeah.
them?
Yeah.
yeah, a joint session with the hub board and the county court. Yeah. It's I mean, we can do that now, but when are we going to enact it?
let's just do the research now. Get the ORS I'd like to review it as well,
Yep.
once you tell me which one it is. And then if we can find out which counties have navigated it a different way, just find out what that means. So we have done our homework too. But they may not know.
I mean,
No.
basically, the way it is right now, as the director being the county employee, she has a second job. She's getting benefits from, payment,
Compensation.
compensation from. And it should have been declared.
Well, it has been. We all knew.
Well,
We found-
yeah, because
That the court doesn't have the ability to supervise.
Yeah.
That position, and I don't think that's.
Yeah, so the budget side of it,
works.
we're talking about, but the other side, we're starting to wander a little bit,
Yeah.
really, into
I know. I
the
was-
court's
I
domain.
just wanted to know how it could be started.
And I,
Those are my ideas, and it affects, and I mention it because it is budgetary, and that would be an option. That would be one thing I would propose to the court and to the board in a work session to say this is, so come up with something else, throw something else on the table. I always kind of like to look at decision making, kind of like the way the government and the NEPA process. You have the NEPA process, you have a status quo, no decision. You stay with the way you're doing things. You have a whatever at the other end of the scale you want to call it, but say we just completely delete it and pull all funding or whatever, right? And usually both of those are ruled out because it's not where you're trying to get to. But then you come up with other options in between that you analyze and decide what works best, the pros and cons of each one of them. So that's really kind of the way I like to do my decision-making process. Is you have one end of the scale, the other end of the scale. Those are ruled out because it's not working, or else you wouldn't be trying to find a solution, right? And then you come up with other ideas in between and find which one works the best.
I'd just like to make one last comment on a different topic, which is the Tyler system itself and its challenges, and whether or not it's just that the support from the provider, it does not do a quick turnaround on fixing some of these things, or if the actual system itself is not up to par for the way it should be for a database to where you enter it and hit it and it gets all fixed. It is an inordinate amount of work for you, Deanna, Bobby Joe, whoever's doing these things, when it's not as simple as entering the right figure and hitting recalculate everything or whatever. Is it not that great a system? Is it old? Are there other, I know we have limited funds, and I know change is very hard and people don't like to, but in
think
2025, it seems like,
Cloud solved
I don't know,
an
I hope
awful lot of your issues.
I'm hoping
It's like an old DOS system versus,
kind of.
versus the clouds. I mean,
well, if a department head was able to enter their own budget
yeah,
and was required to put notes in,
That would
that would
make the
solve
budget committee be able to do it on their own
everything.
easy.
everything.
Yep. And that's what we're shooting for.
yeah, exactly.
I'm hoping that in this cloud-based version, it's supposed to be easier to generate reports and design reports. Right now, we can't generate we can't create a report without going to Tyler and saying, I need a report that adds up all these columns or whatever.
But
Okay.
too hard.
Yeah.
I mean, it's not too hard, but it's just, it shouldn't be that way. You should be able to, I want to see averages, I want to see this, I want to see that.
So the LB1 last year I had problems with because there's one field that doesn't get added up. It doesn't populate it for the report. And I had to go back in and basically on my printed adopted copy and add all those totals up and then plug them into that field. If I had the ability to generate my own report or create my own report, I could tell it, just knowing how databases work, but I could tell it to add all
That column.
this column or this total at the end of each column.
But their system can't do that, they can't just program that.
They can.
Yeah,
I
by
can't.
like, you send them an email and then they program it, it's done. They don't do that?
Well, they do, but it's not quite that easy. Usually it takes a pretty long phone call where it's like, because they're speaking computerese and we're speaking layman's terms, and I'm saying, look, I need to know the total of in each department, or each fund, whatever that is.
Well, everyone's done great jobs so far. I know it's not over yet, but I would move to adjourn this budget board meeting.
A second.
Denied. A motion's been made and seconded to adjourn. Again, I thank everybody for their time this year. Please, suggestions, recommendations, whatever for next year, moving forward, making the process better. I've got notes, but
It's already better.
it's a
It's getting
process
better.
in the works. So
We're getting better.
thank you, everyone.